Say? Okay, so let's quickly do that. So, opening prayer. So just welcome people and then do opening prayer. Okay, let me start, Abby. Hello. Good morning, distinguished ladies and gentlemen. You are welcome to HCPAN Lagos Annual Conference. Apologies for the delay in kicking off this program, but we are here now and ready to start. We want to assure you that the program is going to be worth the while. So we want you to sit back, relax, and enjoy the program as we go through the course of events. I'm Dr. Emmanuel Nuche, the Deputy Chairman, HCPAN Lagos. I'm going to be anchoring this program together with Dr. Nkechi Ubo, an optometrist. So together we are going to take you on this ride and then expect that you are going to enjoy it. But while we begin, it will be nice not to sit beside a stranger. You never know who you are sitting beside. And in a program like this that has a mixture of people, it will be nice for you to know who your neighbor is. So just take a moment and greet someone beside you. Get to know someone. Good morning, you're welcome. I'm Farm this, I'm Dr. this, I'm MLS this. So please let's do that. Some people are not doing it yet. It's possible you are sitting with a colleague or friend you came with. We are going to rearrange the seat. That's right. You're welcome. So, as we kick off the program, we need to start with an opening prayer. And we would like to have that opening prayer said by the only woman with gray hair, beautiful gray hair. Our farm mommy. We would like you to do an opening prayer for us. Yes, please. Let's clap for her as she comes up to take our opening prayer. Opening prayer, please. Ushers, we need you around now, please. The program has started.
All right, please, shall we pray? Our Father and our God, we just appreciate you for a time like this that we set a date, we set a time, and Lord, you are allowing it to come to pass. We thank you, Lord, for what we have already scheduled to take place today. We ask that to be with everything that we shall do today in the name of Jesus. We ask for unity, peace, and love among every member of HCPAN, Lord. We ask that we will work together and we will look after the interests of the society as a whole, of the country, of the patients that we are serving, oh God. Father, we are asking that to take preeminence over this meeting. We ask that to hasten the feet of those still on the way. And we are asking, oh Lord, that at the end of today's deliberation, we shall have more reason to give thanks to you. Father, this we pray, do it for us. In Jesus' mighty name we have prayed. Amen.
Amen. Thank you very much. A great way to start off the program. So next in our agenda is the national anthem. Don't worry, we are not going to tell you to come and lead us because of obvious reasons. The DJ is going to help us. But as we do, in honor of our national anthem, I will ask that we'll be upstanding even as we take the national anthem. Please, let's rise as we take the national anthem.
Nigeria, we hail thee, our own dear native land. No tribe and tongue may differ, in brotherhood we stand. Nigerians own and proud to serve our sovereign motherland. Our flag shall be a symbol that proves and justice reign. In peace or battle honored, and this we count as gain. To hand unto our children a banner without stain. O God of all creation, grant this our one request. Help us to build our nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed.
Thank you very much. Let's clap for ourselves. We have passed the exam.
Good morning, everyone. Good morning, everyone. Thank you very much for representing this morning. In our midst today, we have some special guests, and we would like to recognize them. We have Dr. Tony Adeyemi, representing the Special Advisor to the Governor on Health, Lagos State.
Yes, yeah. Let's applaud as she greets us. You're welcome,
You're welcome, sir.
ma.
You're welcome, ma. And then we have Dr. Gloria Okoikan, Chairman, Nigeria Optometric Association. You are welcome, Dr. Gloria. Dr. Okoikan, you're welcome. Let's applaud. Thank you. Please, you can come forward. As we call our special guests, kindly obliged to move to the seats, the tables at the sides. Thank you very much. We have Farm Tolulokwe Ajayi, Chairman HCPAN. Please, let's applaud. We have Modupe Ogundimu, Director, NHIA. Can we please put our hands together for her? Thank you very much.
Can we see our Director, NHIA?
Is our Director, NHIA, is she in the hall?
Oh,
we don't
beautiful.
have that here.
Madam
Thank
Aisha,
you.
welcome. Let's see our representative. She's a known face. Welcome.
Welcome,
Yeah,
Madam
thank
Aisha. Thank you. We have Dr. Aleton Jeff Tao, our keynote speaker. Is he around? Is he around? Aleton.
Let's put our hands together for our keynote speaker as he comes forward. Let's give some energy here, please.
And right here in our midst, we have the chairman of the occasion, Dr. Olawale Ko. Please, let's put our hands together.
That cannot be the clap for the chairman of the occasion. Please, let's do it again. Thank you very much. You're welcome. Okay, so we also have some other ones. We have Dr. Oluwole Sanda, our immediate, is a past national chairman and a respected elder of this association. Dr. Sanda, you're welcome. In our midst, we also have a past chairman and a leader of the association, in the person of Dr. S.T. Akintade. Welcome, sir.
Also, we have a former zonal coordinator, NHIA, Mr. Kingbade Femi. Let's put our hands together.
Welcome, sir. All right, so we also have the president of HCPAN. I saw her walking. Very elegant doctor, Mrs. Pamela Ajay. You're welcome. All right, so remember, we are not introducing a particular order. People come in at different times. If we have not recognized you, please bear with us. We will recognize you surely and give you that honor that is your due. But while I wait for more, we want to take the welcome address by the Chairman Planning Committee, Farm Isaac Oluwafumini Niyi. Let's clap as we usher him up. Only one man is clapping exceptionally, and it's not proper. We need to give him an award, though. I mean, the camera, I hope you capture the... Yes, you have to climb up. Let's encourage him with our clap until he climbs up the stage. Clap is free now. You don't need to pay for the fuel. Thank you very much.
Thank you, sir. The Honorable Commissioner of Health in absentia, the Special Advisor to the Governor on Health, Chairman of today's occasion, all our guest speaker, National HCPAN President, Lagos State HCPAN Chairman, fellow Biola Polosi, fellow delegates, distinguished guests, ladies and gentlemen. My HCPAN Chairman will still come to establish all the normal protocol properly. So I don't want you to send me out of Lagos if I didn't do it properly. On behalf of the Planning Committee, it is my pleasure to welcome you all to this HCPAN Lagos State AGM and Scientific Conference. We are thrilled to see many healthcare providers gather here today and those that are still on their way coming. First and foremost, I would like to express my gratitude to the Honorable Commissioner for Health, Chairman of this occasion, our keynote speaker, our guest speaker and presenter for sharing their expertise and insight in advance. Your contributions are invaluable. We appreciate you. Can we give them a round of applause? Let's give all of them a round of applause for them to leave whatever they are doing and for them to come and honor God in our life. Thank you very much. To all our sponsors, thank you for your generous support. Your partnership has enabled us to make this conference a reality already. And by God's grace, when we beckon to you next year, which is going to be better, please, we always want you to continue to partner with us. I also extend my appreciation to the organizing team for their tireless efforts, most especially the HCPAN chairman, fellow Biola Polosi, who has been a very good vessel to work with. Thank you very much. Let us also seize this opportunity to learn from each other. Every one of us, irrespective of our different profession, we need each other. We need to learn from ourselves. We need teamwork. And by God's grace, we need to also look at what are the challenges we are all facing and how can we forge ahead. And I'm sure the communication committee will help us do the necessary thing to gather what we need there so that we can be able to work upon it subsequently. Thank you again for joining us. I wish you a productive and enjoyable Conference. God bless you all. Thank you, sir.
Thank you very much for that short and precise welcome address. That's from Isaac Oluwafumini, the chairman of the planning committee that put up this wonderful program that has brought us all together. And we want to also move forward from there. We have a passionate woman who is also a go-getter. You can see the transformation that we have noticed since she came on saddle as the chairman of HCPAN Lagos. She's passionate and ready to move mountains to make something happen. So it's my pleasure to welcome the HCPAN Lagos chapter chairman in the person of farm, Mrs. Biola Paul Oze, as she gives us her welcome address. A round of applause as she comes up to, yes. The camera is watching you. Keep clapping until she comes. Yes.
Thank you so very much. Good morning, all. You are all welcome to this program. An address by the Chairman, Healthcare Providers Association of Nigeria, HCPAN, farm Mrs. Biola Polosi, on the occasion of the AGM/Scientific Conference held on Tuesday, 15th October 2024 at LCC High. The Honorable Commissioner of Health, Professor Akinola Abayomi, that we're expecting, he has to go to another function, and he has promised that he's going to join us soon. The special advisor to the Governor of Lagos State, Dr. Olukemi Ogunyemi, ably represented by Dr. Oluwatoni Adeyemi. The chairman of the occasion, Olawale Ko, who happens to be the immediate past chairman, past president of the Lagos Chamber of Commerce and Industry. You are welcome, sir. The national president, HCPAN, and the person of Dr. Austin Aiko, Insurance Authority, Lagos Zone, Mrs. Mudukwe Ogundimu, ably represented by Aisha Umar, a deputy director in NHIA. The permanent secretary of LASHMA, Dr. Mrs. Emanuela Zamba, that also has sent a representative. The executive secretary, I think she'll be online now, Kwara State Health Insurance Agency, Dr. Olubimi Jetawo Winter. The executive secretary, FEMA, Dr. Abiola Idowu, I think she's not yet in, but I believe she'll join us soon. The keynote speaker, Dr. Jefta Aletan, have various special guests, including a past president, current president, the chairman of Association of the Professional Groups in HCPAN, the special guests, guests of honor, invited guests, gentlemen of the press, ladies and gentlemen. It is with great pleasure I welcome you all to this auspicious occasion of the HCPAN 2024 Scientific Conference and AGM. Today is particularly exciting because we have in our midst very important personalities in the healthcare space and in the society at large. Our Scientific Conference AGM has become a key event in the annals of our programs as an association, as it serves the dual purpose of capacity building and deliberations of vital issues that affect us as healthcare providers. The Healthcare Providers Association of Nigeria was formed in 2004 in compliance with Decree 35 of 1994, 1999, setting up the NHIAs with focus on the National Health Insurance Scheme, now the National Health Insurance Authority, NHIA, established by the NHIA Act, May 2022. HCPAN membership includes healthcare professionals who have facilities registered by relevant regulatory authorities. Membership covers medical practitioners, specialist doctors, dental practitioners, pharmacists, nurses, midwives, medical laboratory scientists, physiotherapists, radiographers, radiologists, optometrists, and nutritionists. Thus, all accredited facilities by NHIA and those registered by private HMOs are automatic members of our association. Our objectives, among others, include endearing a smooth relationship between the providers and all relevant stakeholders in the health insurance industry, viz. the NHIA, HMOs, NECA, and other fund providers. Maintaining a high standard of health care delivery and promoting continued education of provider, just to mention a few. It is appropriate to specially welcome to this event the chairman of this occasion and the person of Ashwaju Dr. Michael Olawale Cole, the Ashwaju of Ojota, who happened to be the immediate past president of the Lagos Chairman of Commerce and Industry. Ashwaju Olawale Cole, being an astute Nigerian business leader, has been invited to give credence to the adoption of health insurance as a health financing option towards the realization of the universal health coverage in Nigeria. And we shall shortly hear his perspectives in his remarks. Honorable Commissioner, sir, that's in absentia. We want to express our gratitude to you for joining us at today's event. We are delighted that a forum like this will enable the Commissioner to get close to the private sector healthcare providers. In a 2023 review by Oyemeleokwi Shelushi, published in Health Ethics and Law Consulting, titled In Review, the Healthcare Framework in Nigeria, it was aptly stated that the government owns health facility accounting for over 70% in the country, while about 60% of all healthcare assets. Please, I take that again. The government owns health facilities accounting for over 70% in the country, while while government owns the most facilities, private healthcare is significant and currently forms about 60% of all healthcare assets in the country. The review further stated that from hospitals to pharmaceutical businesses, from diagnostics to telemedicine providers, from health maintenance organizations to private insurance companies, from contract research organizations to faith-based organizations, which offer health services at various levels, there is a pool of healthcare actors in the private health space. Herein lies the relevance of an association like HCPAN. Of recent, the Ministry of Health in Lagos State has indicated a new paradigm wherein the public health facilities are providing a greater percentage of healthcare services than the private sector in Lagos State. We are waiting further analysis and inferences from this recent report as we are beginning to think of three likelihoods. Either the private sector are not reporting on the DHIS platform, or access to healthcare is now more affordable at the public health facilities, or health insurance uptake is growing speedily. It is appropriate to acknowledge the enormous work the Lagos State government has done in the last 4 to 5 years, and since the Ilera Eco program started off about 4 years ago. We want to commend the Executive Governor of Lagos State, His Excellency, Mr. Babajide Sanwo-Olu, on his recent pronouncement of executive order to make the mandatory social health insurance program realizable in Lagos State. By this act, the Lagos State government has demonstrated commitment to the NHIA Act 2022 and our home previously Lagos State Health Scheme, which was made mandatory from inception. At this occasion today, the Honorable Commissioner will be breaking down the import of the executive order under the presentation, Understanding the Executive Order on Health Insurance by the Lagos State Governor. Honorable Commissioners, sir, and the chairman of the occasion, as you must have noticed, our keynote speech will be on leveraging digital technology to improve enrollment and enhance providers' efficiency in the nation's health insurance program. Recent developments have brought to the fore the role of digital applications in improving healthcare delivery. I must quickly applaud the ministry effort at digitalization through the launching of the Lagos SHIP, the Lagos State Health Information Platform. Without that, this is a step in the right direction. We do hope that after the ship has set to sail in the public sector, the private sector will not be left behind. We have realized the need to strategize and prepare for digitalization. Hence, the engagement of a young and dynamic healthcare professional versed in digital health applications in the person of Dr. Jephthah Aleta to handle this crucial topic. In our midst also had the Sevens Healthcare Digital Exchange representatives ready to onboard providers onto a platform where enrollees, stroke patients, health data, stroke information can be exchanged between providers and HMOs. We have also invited here two important personalities that are on the driver's seat on the health insurance program in their respective states to come on board to share their experiences and what to do to adopt best practices. Namely, her own Dr. Emanuela Zamba and Dr. Fam Olubunmi Jetawo of Kwara State Health Management Insurance Agency. This is necessary for cross-learning and growth of health insurance in our country. Honorable Commissioners, sir, and the chairman of the occasion, while we acknowledge your good intention, that's speaking directly to the commissioner, and proactiveness in setting up the technical working group on the executive order with express directive to provide inputs for the operating guidelines for a private sector-driven health insurance industry that will rapidly upscale enrollment of residents in Lagos State and ultimately accelerate universal health coverage. We must say that three crucial areas that must be well defined for success are: one, classifications of facility, viz. Primary, secondary, tertiary; professionalism and quality service delivery; and payment mechanisms. If we look closely at those three critical success factors and we're able to attend to the challenges in those areas, I think health insurance will be on its way to be granted and to be accelerated in our nation. Fellow healthcare providers, before I round off these welcome remarks, I need to intimate you with a development at the Federal Ministry of Health. Precisely on 12th December 2023, the Ministry of Health, the Federal Ministry of Health, adopted the SWAP approach to running the health sector. The SWAP approach is based on one plan, one budget, one report, and one conversation. At a health policy dialogue event organized by the Healthcare Federation of Nigeria, that's HCPAN, I was invited as a panelist and was asked what I would do with the information I have been inundated with. My response was that since SWAP was yet to be communicated clearly and objectively to the private sector, we shall take it up to hold capacity development programs to ensure that our members understand this model of delivering health services, which reportedly has worked in many African nations, including Ghana. Hence, we hope to run a webinar shortly on this approach and invite relevant stakeholders. For emphasis, SWAP is not another program. It is just an approach. I want to appeal to all providers to stay through the presentations and also partake of the AGM. I want to appreciate the Honorable Commissioner, the chairman of the occasion, the keynote speaker, and the two guest speakers for accepting to participate at this event. We thank all our special guests and guests for attending this program. Our appreciation goes to all our sponsors, members, and companies that that supported us in cash and can through goodwill messages and adverts. I wish to acknowledge the executive committee and council members of HCPAN, as well as the chairman of the affiliate professional bodies. Thank you for collaborating and cooperating with us over the months. Thanking you all for participating at this event. I wish you all a rewarding time. Thank you for listening.
Thank you so much. If you listen keenly to our chairman, HCPAN Lagos, you would have got the meat of today's meeting. She has done a good summary of why we are here and also whet your appetite on what is expected. All right, so before we go to the next, we still have some special guests who are here. We have the immediate past chairman, HCPAN Lagos, Dr. Ademola Aina. If you are here, let's encourage him. Welcome, sir. It's good to see you. We also have some chairmen of professional groups who make up HCPAN. We would like to also recognize some of them who are here. I don't know if Rad Obeoluwa Oduwole, the chairman, ARN, Radiologists Nigeria. Oh, beautiful. You're welcome, ma. All right, so we have Farm Tolulope Ajay, chairman, HCPAN. You're welcome, sir. Then we also have Dr. Remy Durojaye, chairman, NSP, Nigerian Society of Physiotherapists. Are you here yet? Yes, we can clap in absentia. It's allowed. Okay. Thank you. Then we have Dr. Gloria, who were earlier recognized, but she can also wave. Dr. Gloria, okay. Yeah. Welcome. Dr. Gloria is the chairman of Optometrists, Nigeria Optometrists Association. You're welcome. Then we have MLS Abimbola Adekoya, who is the chairman, Guild of Medical Laboratory Directors. Yes, so you can see him standing. He's always active. You're welcome, sir. Then we also have Dr. Segine Jonathan, who is the chairman of ANPMP. Dr. Segine Jonathan is unavoidably absent, so I'm wearing a dual cap. I'm the first vice chairman of ANPMP Lagos, so you can also clap for me. Thank you very much. So he said I should represent him in this event. All right, so we also have Dr. Olawale Oladapo, who is also incidentally one of the anchors of this event. Is waving at you from up this side, HCPAN. That is our nurses, Association of General. Yes, encourage. You are showing that your people are here. Thank you very much. All right, so we have Dr. Shoneye, who is Dr. Shoneye, are you around? He's not around yet. All right. And then Dr. Afolabi Ogunderu, president of Private Dental Association. He's not here yet. Okay. So I also want to recognize the presence of the immediate past chairman of ANPMP Lagos in the person of Dr. Akinlemi Bola Makinde. You are welcome, sir. Then we also have a big masquerade in HCPAN, our immediate past president, in the person of Chief Dr. Aribabu. You're welcome, sir. We have Dr. Ogunkoya Michael, who is from the Commissioner of Health office. Please, we would like to recognize you. Yeah, welcome. You're welcome. I hope, is heralding the coming of Commissioner. All right, so while we await to also recognize others, it is my pleasure to tell you that we are going to the next. You can see that we are managing our time pretty well. So it's that time where we want to hear from the chairman of the occasion, which we can say is opening of the program proper. So we would like to take the opening remarks by the chairman of the occasion, Dr. Olawale Cole. Yes, go ahead and now the chairman with a clap for, no be me, no be me. He is immediate past president, Lagos Chamber of Commerce and Industry. So if you know clap well, they fit evict also. Thank you very much. You're welcome, sir.
Thank you. Let me apologize that I have the temptation to stand on the protocol already very well established. Just to save time, haven't lost some time in starting this program. But of course, I must recognize a few people who are here or who are here represented. We have here, like I've been told, well, my friend is said to be here, Commissioner for Health. In absentia, we will soon be here, I was told. Then we have the advisor to the governor of Lagos State on health. As far as we are concerned, the advisor here today is Dr. Oluwatoni Adeyemi. So you're on the way to be an advisor to the governor on health. God help you. We have here also the national president of HCPAN, Dr. Ipo, maybe yet to come. We have Director NHIA Lagos Zone, Mrs. Ogundimo, represented by Ajia Umar. Of course, I must acknowledge pharmacies, Mrs. Biola Paul Ozier of HCPAN, who is the current boss of the body. I also acknowledge all the past chairs or presidents of the association. Then all of you here are distinguished. So, very distinguished ladies and gentlemen. We are here today on a theme, leveraging digital technology to improve residents' enrollment and enhance providers' efficiency in the nation's health insurance program. It is both to me a great honor and privilege to be asked to speak on this subject here today, which touches the core of healthcare accessibility in Nigeria. Leveraging digital technology to improve residents' enrollment and enhance healthcare providers' efficiency in Nigeria's health insurance program. Nigeria's healthcare system, as we all know, faces multiple challenges, from access to resources, to service delivery, to infrastructure deficits. The National Health Insurance Authority, NHIA, is a very critical vehicle designed to ease these burdens. But we all know that its impact is still limited due to low enrollment rates and systemic inefficiencies. Regardless of efforts by our government and the healthcare stakeholders, many Nigerians remain outside the health insurance program. This gap in enrollment limits access to essential healthcare services. One of the most promising solutions to bridge this gap is the implementation of an efficient, accessible, and scalable health insurance system. And this is where the transformative power of digital technology comes into play. In line with our theme, let me briefly outline some methods of leveraging digital technology to improve residents' enrollment and also enhance providers' efficiency in our nation's health insurance program. Kindly note that we already implementing some of this in Nigeria, but we still need to define and improve on them to reach a wider coverage. Let's look at one: mobile enrollment solutions for wider access and simplicity. The rapid increase in mobile phone usage in Nigeria presents a golden opportunity to simplify the health insurance enrollment process. According to the Nigerian Communication Commission, NCC, in October 2023, that's last year, Nigeria's active mobile subscription has reached 220.7 million as of August last year. We can harness mobile technology to provide a seamless and user-friendly platform for residents to enroll in the health insurance scheme from the comfort of their homes and offices. Mobile apps and USSD can also be developed to allow users to input their personal information, select their preferred insurance plans, and enroll in minutes. For those without access to smartphones, the USSD service, commonly used for banking, can enable the same process on feature phones. By removing the need for residents to physically visit insurance offices, we can drastically increase enrollment numbers, especially in remote areas where healthcare access is very, very limited. For providers, mobile transforms and platforms can provide instant access to patients' insurance status, streamlining processes and allowing for quicker service delivery. Let's also look at integration with the national digital identity systems. One of the significant challenges in health insurance enrollment in our country is accurately identifying residents and linking them with their records to a consistent database. The integration of the NHIS with the National Identity Number, NIN, system can provide a seamless, secure, and very unified enrollment process. By synchronizing health insurance data with national digital identity system, duplication of records can be avoided, and residents' profiles can be verified more easily. This linkage ensures that residents personal details and healthcare histories are accurately maintained, improving the overall efficiency of the healthcare system and reducing the administrative burden on providers who will otherwise struggle with unverified or incomplete data of people. For healthcare providers, having access to these digitally verified identities reduces the risk of fraud and duplication within the system. Care is delivered more efficiently while minimizing the delays caused by administrative discrepancies. Number 3, let's look at data-driven outreach campaigns. A key reason for low enrollment in this is that many Nigerians, particularly in rural and underserved areas, they are not aware of the benefits of health insurance. Digital technology can address this issue by using data-driven outreach campaigns to promote enrollment. This, to me, is a very vital instrument to project this more to the people, particularly those who are in rural areas. Social media platforms, SMS, and online advertising can be employed to target specific demographics, ensuring that the message reaches those who need it most. Digital outreach can also include educational content in multiple languages, explaining the benefits of the NHIS, the steps to enroll, and the services residents can access once enrolled. By utilizing big data analytics, providers can optimize outreach campaigns in real time, adjusting the message based on response rates and feedback from the target audience, ensuring a more effective and very comprehensive outreach. Number 4, let's look at telemedicine and e-consultation platforms as incentives for enrollment and creating expanded healthcare access. Telemedicine is another powerful tool that can both improve enrollments and enhance healthcare providers' efficiency. By offering telemedicine services, the NHIA can incentivize people, more residents to enroll, as they will have access to healthcare consultations from the comfort of their homes, especially in underserved and remote areas. This not only improves access to healthcare, but also reduces the burden on physical healthcare facilities, also optimizing resource usage for healthcare providers. Telemedicine platforms also allow doctors to consult with patients in real time, reducing unnecessary hospital visits, managing chronic conditions more efficiently, and improving overall patient outcomes. For healthcare providers, telemedicine enables more flexible working conditions, allowing them to attend to more patients without the limitations of physical space. This increases their efficiency and improves patient through output without compromising the quality of care. Let's look on a closing note at AI. That's item 5, AI-powered enrollment assistance and predictive analysis. Artificial intelligence, AI, offers incredible potential in revolutionizing both resident enrollment and healthcare provider efficiency. AI-powered virtual assistants can guide residents through the enrollment process, answering common questions and simplifying decision-making based on their personal circumstances. AI systems can also analyze residents' social economic data and health needs to recommend tailored insurance plans, ensuring that residents choose plans that suit their health profiles and financial capacities. This level of personalization reduces confusion and drives more people to enroll. These chatbots, which can communicate in multiple languages and dialects, will also answer common questions in real time. On the healthcare provider side, AI can improve efficiency through predictive and analytics by analyzing patient and population data. Healthcare providers can better anticipate patient demand, allocate resources, and schedule staff more effectively. AI can also assist with managing patient flow, ensuring timely service delivery, and, of course, avoiding bottlenecks in healthcare facilities. In conclusion, ladies and gentlemen, the future of healthcare in Nigeria is digital. I say again, the future of healthcare in Nigeria is digital. And the time to act is now. By leveraging these digital solutions, we can dramatically improve residents' enrollment and enhance providers' efficiency in the nation's healthcare insurance program. However, this transformation requires collaboration. Governments at all levels, national and subnational, healthcare institutions, tech companies, and medical practitioners, like those who are here today, like yourselves, must work together to implement these solutions. This digital transformation is not just a technical task, but a collective mission to build a healthcare system that is inclusive, efficient, and sustainable for all Nigerians. As healthcare professionals, you play a pivotal role in leading this transformation. Your advocacy, innovation, and your dedication will ensure that digital technology enhances the lives of millions of Nigerians through improved access to healthcare insurance and better healthcare delivery. I want to thank you all for your attention, and I look forward to the discussions and collaborations that we arise from this conference, I want to conclude by saying, together, we can make healthcare better in Nigeria. We can make healthcare in Nigeria more accessible. And also, we can make healthcare more efficient for all. Thank you very much.
Another round of applause, please. It's a chairmanly delivered remarks. Exactly. A standing ovation, please. Thank you very much. Thank you. So, key things that he said, that the future of healthcare is digital. It's good to take note of that. And he also said, for that to happen, there will be lots of collaboration. You may be seated. And collaboration is needed at governments, several levels. And so that's a very rich presentation. Thank you very much, sir, for this well-researched presentation. We really appreciate it. So before he goes, you can see that our chairman is still standing. We want to quickly present award for him, because I know he's a man that is very busy and has so many things. So I want to call on our state chairman, HCPAN, to come up stage, and supported by the past presidents of Dr. Sanda and Chief Dr. Aribabuo, as they present award to our distinguished chairman. Let's clap as they come up stage to make this presentation. Thank you. Yes, even our current HCPAN president is in that train. Welcome, sir.
Okay. Good morning, everybody. On behalf of Healthcare Providers Association of Nigeria, Lagos State Chapter, we really appreciate our chairman. He has been a former chairman of Chambers of Lagos State Chambers of Commerce, past president of Chambers of Commerce, and is a foremost, entrepreneur in Lagos State, all over Nigeria, I must say. He has given us a very detailed, in fact, to me, he has even given the lecture, the way to go in our healthcare space, and that is digital. Definitely, we are going to follow it, and we've started it, and it's going to be done by the grace of God. So, sir, for being the chairman of this occasion, we appreciate you, and I want to present this award on behalf of the chairman of Lagos State Chapter and the healthcare providers in Lagos State. Thank you very much.
Thank you very much.
So, sir, in furtherance to what we've just done, we have this token to also show appreciation for your presence and for the wonderful lecture you have delivered. Congratulations. Thank you very much, sir.
Thank you.
Thank you very much. Well, I've what's the other one?
The award.
The award, yeah. The award. It's going down.
Okay, the award.
Let me say with all humility, I have received many awards in my life, including MFR and CON. And I had served Lagos State as Finance Commissioner, later Commissioner for Works and Transport. I'm saying this because with the weight of this award, I can say it's the heaviest award I've ever received. I therefore promise I'll put this among my several awards in my office at Ikoyi, and it will be in a very, very conspicuous place. People can say it. I want to say a big thank you for this honor. And let me say, I'm for you available any day. Thank you very much.
Thank you very much, Asiwaju Dr. Michael Olawale Cole, CON, MFR, FNIM, CNIM, FCIOD, whatever it means. Let's clap. All right. So that's a good one. While all this were going on, we had some more of our guests and leaders also coming. We have already seen the president of Healthcare Providers Association of Nigeria in the person of Dr. Austin Aipo. He's here. We can also give him a formal welcome. And while at it, we also saw the executive director of HEFAMA in the person of Dr. Mrs. Abiola Idowu. You're welcome, ma. Have you seen Dr. Abiola? She's here. Yes, all right. You're welcome. And also, just walked in is the president of ANPNP in the person of Dr. K. Adeshola. You're welcome. Okay, so
thank you very much, everyone. Next in line, we have a scientific presentation by Sevens Healthcare, just for 20 minutes. Let's put our hands together to make welcome Sevens Healthcare representative. Please, let's put our hands together for them. Thank you.
Yes.
Introduce yourself. Thank you.
Good morning. Let me appreciate and acknowledge the chairman of this occasion and all the distinguished guests at the high table and every participant here. Because our time is limited, Chairman, you will please permit me to stand on existing protocol. And for everyone that's participating, there's one word that the chairman concluded his opening remark with, and I want to anchor on that word. He said, and I quote, "Digital healthcare is the future of healthcare in Nigeria." Did you all hear that? Let's give him a rounding applause. He has spoken like a prophet, hoping that his prophecy will come to pass in Nigeria in years to come. But may I say that God has answered his prayer before he made the prayer. And that future That digital healthcare is here with us now. But before we present, I want to find out, to be sure that we are all on the same page. If you have a healthcare facility, maybe hospital or clinic or diagnostic center or lab or community pharmacy, optometry center or physiotherapy center or any of the care providing outlets, and you have contract with multiple HMOs, if you are here, can I see your hand up, please? I just want to be sure. Wow, they are here. For those of you raising up your hand, have you ever prayed that one day your transaction with all these multiple HMOs will become streamlined, simplified, easy, user-friendly, transparent, and rewarding? If you have ever had a reason to pray that prayer in your use of different platforms as well as different means of doing your business with HMO, let me know if some people have had to pray that prayer, either consciously or they are here. Thank you very much. May I also say that your own prayers also has been answered. On that note, I want to introduce our team from Sevens Healthcare. Today, we have here myself, a co-founder of Sevens, that powered complete care, as well as with us, we have our director, Dr. Adeola Eniola, and also some of our team members that are outside. We have Ginika, we have Alaba, we have Charles, and we have Splendor. All of us will be working together to make sure that your facility is well registered on complete care so that you can begin if you look there, begin your digital transformation. Don't leave this place without beginning that journey. On this note, I will invite Dr. Adeola Eniola to give us a very short presentation. After that, I will come up again and give a short demo. And after that, our team will be at the back. As you step out during the course of this AGM, they'll be there to make sure they guide you to register your facility on this digital transformation exchange. Dr. Adeola, let's have you. Thank you.
Good morning, distinguished ladies and gentlemen. Mr. Chairman, sir, thank you very much for having us. Please permit me to stand on existing protocols. I will be making a short overview presentation on our innovation today. First slide, please. Every scientific inquiry begins with a problem statement, as we all are scientists, you know. And thankfully, Mr. Chairman has made our job here easy, and he has outlined both the myriads of problems that we face in the health sector as an ecosystem, us being providers, payers, governments, regulators. And he has also outlined a myriad of possibilities. And there's one single thing that goes through those myriad of possibilities as solutions, and that is digital. And so today, we want to present to you one innovation born out of that walking through the problem statements with you, which is why we ask the questions. We are trying to put in and bring growth, into health insurance uptake. But that also means that with more health insurance comes more administration. It comes with more hassle. It comes with more difficulty with being able to track your revenues, receive revenues if we continue in the manual way. And so today, Sevens Healthcare bring to you one such innovation to bring this problem statement, to a resolution. And so, next slide. Who are we? Just to give us context. We're a health tech company. We were founded a few years ago through a collaboration of medical doctors, healthcare providers like you who understand your problems, and techpreneurs. And we were not just founded on this platform, we were also founded from a research basis. We were researching into how we can actually interconnect health systems. And we are really on a mission to transform healthcare. We believe really that a high tide will rise all boats. So we're not strictly going from player to player. We want to be able to bring solutions to the ecosystem through industry-grade, innovative platforms, solutions, if you call them, that can transform and help us to leapfrog as an industry or as an ecosystem of healthcare, of the healthcare industry. And this we want to achieve through collaborative partnerships. Next slide, please. Okay. So our vision is to be a foremost healthcare technology partner. And that's what it's all about. We want to partner with you, understand the problems of the industry, and partner to deliver the solutions together. And key is working through strong partnerships. And that's why we're so glad that we're here to partner with HCPAN to deliver an industry ecosystem changing innovation that can simplify healthcare, that can streamline healthcare, and that can deliver to all of the players, all providers, payers, governments, regulators, and of course, at the end of the day, the consumer of healthcare. So today I come to present to you the Complete Care Digital Exchange, or a digital exchange. So what is a digital exchange? If you look there, or if you look into your one of the pages of your brochure, you'll see that we are asking you to begin that journey, that one step of your digital transformation journey with a Complete Care Digital Exchange. So what is this digital exchange? This is the innovation we bring. It allows for real-time exchange of critical transaction information between all the players in the healthcare value chain in a standardized, safe, and secure way while maintaining the individuality of each player. So here, we're not saying you need to replace your existing platform if you have one, but you may imagine it as the highway or the expressway where information flows back and forth across all of the players in the industry. And that exchange is capturing it and transmitting that information in real time to everyone. And the fact is that this is not just happening for one player alone, but it's actually happening for multiple payers or multiple players in the ecosystem at one time. So let us take the use case of you have multiple HMOs that you deal with in your facility. So you have the insurance system there, and then you have the exchange. Like we said, we're working in collaborative partnerships. So we're working with HCPAN, a collaboration or an association of providers. On one hand, there's HIMCAN, working with an association of insurers. And so there's an exchange. And so between the insurer system, there is an API with embedded security, And of course, between the exchange and the provider system, which is you, there's also an API. So we sit in the middle and help you exchange that information. So on one side of the insurer, there can be as many insurers as possible. So you do not need to have separate portals for different insurers. But because all the insurers are on one exchange, you can actually deal across board in a standardized manner with them. However, like we said, this does not replace your system. This does not replace the insurer system. It is just an exchange. It's more like a toll which is counting those critical transactions for the industry and for the player. Next slide, please. Okay. Sorry. So what are the features of this exchange? Number one, it's a single provider interface to multiple players. So when we talk of payers, we say those that are actually where you actually submit your claims and you get reimbursements. And like we all confirmed today, each provider, whether hospital, clinic, pharmacy, labs, diagnostic centers, you all interact with multiple HMOs sometimes. And, in Nigeria, I know we have the NHIA here, and we have the Lagos State here. We have close to 70 HMOs. And as we continue to grow the numbers, these payers will increase. And that will mean multiplicity of plans, benefits that you have to interpret, that you have to administer, because it is at the level of the provider that care happens. And so what we present to you as the exchange is this single interface, a gateway to multiple payers. Number two, it is also a clearing hub for key payer transactions. All of those things that enable you to actually administer care. One, member verification and eligibility, authorization management and tracking, claims management and tracking, and payments gateway, wallet management, transaction management. Above all of this, our pharmacist Ozia, chairman of the Lagos State HCPAN, said something very important during her opening remarks. She said she was contesting or wondering about the data that was emanating from Lagos State, postulating that there are more healthcare, people actually are using more public healthcare than private healthcare. And this is a little different from what has always been. And why would we contest that? Why is there a difference in data here and what we think is anecdotal there? It's because really there is no way that we've been able to aggregate data, and we as providers sit on a lot of data. What the health exchange enables us to do is that we are able to anonymize all this data from the different players and aggregate them and give us analytics, both at facility level and at HCPAN level. It is also ICD-11 coded, so for the first time across all facilities, we are all speaking the same language. And imagine what that is doing at the population level. When we say malaria, it's malaria. When we say hypertension, it's hypertension. And that means we now have the data with which we can use to influence outcomes. And of course, it's interoperable because it's working through integration. Next slide, please. So what is the industry value? Why is it important that we go this way? So we said it's a single provider interface for multiple payers. It enables authorization automation. That's a key health insurance transaction. It now allows real-time or close to real-time claims management, which means the industry on both sides can now adopt common standards for turnaround times because we now have the engine to power that. It's also an integrated one-stop shop processing hub, so end to end, both from the marketing side of it, the enrollment side of it, up to payment. There's data security and protection. It allows for data aggregation and analysis, for actuarial determinations, which has always been a problem, pricing health insurance rights. Many times as providers, we feel we're on the receiving end because the data from healthcare that we're giving is not syncing with exactly what we're being paid or what is being charged to the client. And of course, for the first time, it encourages business transparency. All the players in the ecosystem are able to know what each one is doing. You also are able to engage, to have it with no upfront fees. There's a 30-day risk-free trial period, and the payment systems payment is is flexible, and then it can be customized. That is why it is an industry-based innovation. So why now? Next slide. Why now? There are pull factors and there are push factors. And like we continue to say, the future of healthcare is digital. The pushing factors are the inefficiencies that you are experiencing as you continue to expand your scope of stepping into health insurance. It's increasing your overheads because people have to learn the details of this plan, of that plan, go to 40 portals or 50 portals. And then there's the pull factor. There's a lot of legislation, and this legislation is pushing lives your way. This legislation is compelling us that now there are going to be digital platforms in use. And so there's no way to go but digital. I will not go or delve into that more. And that's why we have embarked on this partnership journey. We know that the journey of 1,000 miles begins with one step. We have continued to partner with different partners in the ecosystem, and we're happy to say that we have an ongoing partnership with HCPAN as well as other partners to actually deliver this digital platform and gateway for all members of the association. I would just invite Dr. Ogunfoko, Dr. Benga, to give us just a view of the interface while we can come to our stand for a full demo. Thank you.
Thank you very much. I was told I have very few minutes, and I want to do it in the military way. So let's go to the Chrome. In 5 minutes, all that she's been saying, you need to see it. So once you go on Complete Care, www.completecare.com/register, you will see, can we go to Chrome? You'll see Can we go to Chrome? Yeah. Can we share it? All right. So in 5 minutes, once you go to www.completecare.com/register, it will take you here. So whether you have your own health facility, can you scroll up? So this brings everybody in the healthcare ecosystem together, the patient, the nurse, the doctor, the hospital, the pharmacy, the laboratory, the HMO, and also at the primary care level. So it takes care of primary care, secondary care, tertiary care. So for hospital, whether it's a small clinic, a physiotherapy clinic, optometry clinic, ophthalmology clinic, or ENT clinic, or any clinic, or just immunization clinic, or fitness clinic, as long as you are providing care directly to patients, you come under the hospital. Lab, you go to lab. If you're running diagnostic, you click on lab. You just register. The registration is less than 1 minute. Once you do that, we'll get in touch with you. We'll onboard you and your staff. So this is what this looks like. Can you go to the back button? Click the back button. The very back button. Okay, so once you get to, or you go back again and get to the, yes, go back completely, go out. Yes, click that. Click the back button. Okay, just click the complete care icon on the top. The very top one, yes. Okay, remove the, after the slash, just go to .com. Remove that, yes. Just go to .com. Quickly. Then go to login. Just log in straight. Log in. That's all. Once you are registered, you just log in. Very simple. When you log in, have you logged in? Click on login. Okay, it's logging in. Once you log in, I will show you all that she has been talking about and more is what you will see. You will see how you can manage the HMO, all your HMOs, even if they are 1,000. You can manage them in one interface. So this is what you see. Can you scroll down? So we're focusing on HMO. I know the chairman, no, just scroll up, sorry. Scroll up. I know the chairman talked about telehealth. Telehealth is there, but this is not the time to talk about it. If you want to consult beyond your immediate reach, you have people requesting to come to your hospital, you have that. But let me focus on this. So can you go to what Dr. Deola has told you? You can do enrollee eligibility. You can do HMO management. Can you click on HMO management? Click on HMO management. Click on it. Okay, click down again. So you can see the first one there, authorization. Don't go to it. The next one is, can you go to claims? Because of time, go to claims. Click claims. Click claims. All right, so once you click on claims, you can manage all your HMO. Can you come to the HMO button? The drop down, HMO drop down. The drop down, click on the drop down. You will see all your HMOs there. So once you see all your HMO, the one you want to file claim for, you just file claim for it. Just click on any one of them. Click on Total Health Trust. Total Health Trust. Right. So once you click on it, you put the ID of the patient, of the enrollee. Once you put the ID of the enrollee, you go straight away, you file your claim. So there's so much more that you can do. Claims management, you can see the various plans of the HMO. All the HMOs, their plans have been brought to you in one single interface. These are much more we're going to tell you, but because of time, all you need to do is immediately after now, maybe during lunch, during break, just come and meet us at our stand there. We have our team of staff there, and they will guide you. Within 1 minute, you're able to register, and we'll get in touch with you. We onboard you and your facility, including all the people that your staff that needs to use the platform, we train them in-house. Thank you very much for your attention. Yeah.
Thank you very much, Sevens Healthcare. That was a wonderful presentation. Thank you, Dr. Diola Eniola. Let's put our hands together for them. While we are waiting for our Honorable Commissioner for Health, we'll take the next in line, which is the keynote address, titled Leveraging Digital Technology to Improve Residents' Enrollment and enhance providers' efficiency in the nation's health insurance program. This will be done by Dr. Jephthah Aleton. I take his citation. Dr. Jephthah Aleton's background is in healthcare, holding a bachelor's degree in dentistry from Obafemi Awolowo University, with over 7 years of experience in brand design, products, and service design. Jephthah's expertise spans across various domains. His background in healthcare allows him to approach design challenges with empathy, ensuring that Wella Health products are not only visually appealing, but also intuitive and user-friendly. As design lead, Dr. Jephthah is committed to crafting compelling and impactful solutions that enhance user experience and drive engagement. Dr. Jephthah plays a crucial role in shaping Wella Health's brand identity and ensuring consistency across all touch points. Please, let's put our hands together as we make welcome Dr. Jephthah Aleton.
Good morning, everyone. I'm so happy to be here, and thank you so much for having me here. Like every other speaker here, I'm standing on all existing protocol also because of our time that's been well spent. And this afternoon, we are going to be discussing how we can leverage digital health technology to improve residents' enrollment and enhance providers' efficiency in the nation's health insurance program. Like it has been stated, I work as the Chief Design System Officer at Wella Health Technology. And at Wella Health, what we do is basically serving as a third-party administrator, but we leverage digital health technology to solve all whatever challenges we've seen. And that has given us a lot of opportunity to be able to be at the pole position, working with individuals that need access to care, but also work with health providers to be able to do their work very well. Now I will be starting the presentation. The future of healthcare is digital, like it was said earlier, and that future is now. And it's amazing what we are currently doing in the country. There's been a lot of innovation, a lot of amazing technological digital solution for healthcare in Nigeria, and that will keep growing. But it's very important and imperative for all of us, especially we, the healthcare providers, to buy into this future and also start implementing as early as possible. That was a wonderful presentation by Complete Care. That is a very big problem for a lot of healthcare. And these are one of the examples of so many things that are happening now within this space. So, let's consider some statistics about the Nigeria insurance space. The last report that was made about the insurance coverage in Nigeria says that just about 3% of Nigerians are insured. We have a population greater than 200 million. This means that there are a lot of Nigerians that are paying out of pocket whenever they need to access healthcare. People go to pharmacy, they have to pay out of pocket. People go to medical labs, they have to pay out of pocket. People go to hospitals, they have to pay out of pocket. And we all know how important health insurance is. It's one of the measures that we can use to prevent people from running into bankruptcy. A single illness now can take someone that used to be wealthy to become really, really poor. And that is why health insurance is very important. Even aside from that, people that would normally not be able to access care, health insurance allows them to be able to belong to a pool of people that will be able to access care that they would normally not have access to. So Second Stat says 76.6% of healthcare spending in Nigeria is out of pocket. And the market size for health insurance forecasted for 2024 in Nigeria is about $6.97 million. So there's a lot of opportunity here for us. Now, what does this conversation going to be? It's going to help us see how digital tools can help us to reach more millions of people in Nigeria. Why is health insurance important? We are all preparing to achieve universal health care at some point. And health insurance is a linchpin in this process. It helps us to ensure that everyone, regardless of their income level, can access essential health services without suffering financial hardship. And for Nigerians to be able to achieve UHC, health insurance is a must. We must all, as much as we can, ensure that a lot of Nigerians are registered with an health insurance company, or with the state health insurance, or with the national health insurance. And why? Like I've mentioned, financial protection, access to care, and preventive care becomes more rampant. People, health insurance organizations do not want to start taking care of chronic illnesses. So with health insurance, people are now forced to go to hospital earlier, and diseases can now be detected faster than it would be when people don't have money. A lot of people will have to wait till they become very sick before they can access care. With health insurance, that becomes reduced. People will actually leave their home and go to clinic, knowing that they are not going to lose all their money to taking care of themselves. Now, some of the key challenges that health insurance face in Nigeria, I'm going to mention 4. The first one is low enrollment. Why? If you have ever tried to sell health insurance to a Nigerian, when you tell them, daddy, please pay 1,000 every month so that when you fall sick, we will be able to take care of that treatment for you for free. You will hear, God forbid. They will say, why should I be paying ahead? Are you planning for me to fall sick? That is how we think as Nigerians. The other one is that Nigerians are not educated and don't know so much about health insurance. So there's low enrollment because of some of these factors. Also, our health-seeking behavior. If I ask even us the health practitioners here, when you start feeling sick or start feeling somehow, where do most of us go first? Over-the-counter drugs, right? Most people will likely go to their community pharmacy, first go and buy medications, try and take care of themselves before they even go to hospitals, right? So that's one problem. The other one is infrastructure limitation. The truth is, for most Nigerians, from some of the research we did at our company, for people to be able to access care in Lagos, for example, in a secondary health institution or a tertiary institution that is far away from them, it takes approximately of 3 to 4 hours from commuting to waiting time to finally accessing care. And when you now even get into the hospital, payments department is far away from where you will do tests. Where you will do tests is far away from where you are going to get care. You know, some of these infrastructure limitations cause problems. Aside from that, there's poor internet connectivity, there's outdated medical records, there's a lot of lack of integration among facilities within the country, and that is one of the problems. The other one is inefficiencies in our claims processes. Claim processes for most insurance companies are now getting improved than before. Before now, it used to be paper. People will have to take papers to be able to make their processes. But now, a lot of innovation are coming out within that space. Now, what are the digital tools we can use to help improve enrollment? The first one is something that all of us know about: social media communities, right? We all know someone called Aproko Doctor. Aproko Doctor is one of people that are practicing something called social health. They spend and put time to educate and instruct people about healthcare. Now, this is an opportunity for us to reduce the low enrollment rates. It's very important that Nigerians are educated on what health insurance is, on how they can access it, on the benefit that comes with it, and how it can help improve their life. And we can leverage social media for this. Health influencers, health educators, Facebook groups, WhatsApp communities, TikTok, Instagram content cannot be leveraged. And we all here, as healthcare providers, can also leverage this. Even for our own businesses, we don't have to advertise our shop, but we can actually help educate people on why they need to be insured and how they can get it. The other one is using mobile and web applications. For a lot of health insurance in Nigeria, especially the private ones, mobile and health application is helping them, and web application is helping them to be able to get access to the young, vibrant Nigerian population. A lot of us now have our mobile phones with Android OS or iOS. Now, it's possible for us to access online platforms. And these platforms are making it easy for us to be able to access health insurance. Companies like Reliance, HMO, and Wellite, for example, have built systems that allow people to be able to read information about their insurance and also pay for it on their mobile phone, right? So it makes it possible for them to enroll seamlessly. It makes it possible for you to be able to claim your benefits faster. It makes it possible for you to be able to text your doctor faster. It makes it possible for you to be able to get support and push, and also get notification from the HMO. One important thing also is that we need to meet people at their point of convenience, right? So there are important questions we need to ask. Who are these people? Where are they? What do they need? How do they communicate? How do they get information? And how do they access care currently? When we find answers to all these questions, it helps us to be able to improve how we communicate with them. The third one is SMS and USSD-based enrollment. USSD technology was designed to give people with feature phones access to things that they would normally not have access to, right? So with USSD technology, it's possible now to do *55 something hash and give people access for them to be able to actually buy an insurance plan. In fact, people are now proposing that people should be able to buy a healthcare plan with their airtime. So part of things we, for example, did at Wella Health was to start looking at how we can connect with business within telco spaces, and how these people can help us to be able to make sure that Nigerians that would normally buy data and buy airtime every day can actually use those things to be able to pay for their healthcare plan. Hopefully, there will be some, headway in this in the future. But given the widespread of mobile phones, even in remote areas, USSD is making it easy for people to be able to access care. Same thing with SMS outreach. Health insurers are leveraging SMS campaigns to reach potential enrollees in rural and underserved regions by sending targeted SMS to them. That way, insurance can educate their populace. They can also facilitate enrollment. Other ways tools that we can use to improve enrollment is with mobile money and digital payment solutions. Platforms like OPay, and PalmPay, and Paga, Artis Wallet, all these agent banking guys with their kiosks all around Lagos are potential partners for us. They already have the ears and the eyes and access to people. Now, how can we leverage these people to be able to expand reach for health insurance? Mobile money plays a role here, right? Agent banking is an amazing feat that Central Bank has done for us in the country. They are potential partner for us. And for example, we are already doing that as Wella Health. We partner with Paga, and Paga agent sells health insurance to people within their community because they are there. They trust them already. They give them their money every day. So these are potential partners for even to the state government and the federal government to partner with to spread access to health insurance. The other thing we've done is that we've seen that telco services are very important. So health insurance can actually be merged with these telco services. For example, if you dial *141*44# right now on an Airtel line, you will see a prompt that tells you to buy data and get access to free health plan. That was made possible because of a partnership between AXA Mansard and Airtel. Now, this free health plan allows people to be able to actually speak with a doctor. Why? Because they bought data. Wella has built a tool called Zoe. Zoe basically does the same. Every time you buy data on Zoe, you get access to free telemedicine service. You get access to a free tier of WellIS plan that can now be upgraded to a bigger one. But these tools basically help us to be able to reach people in places that they would normally not have access to care. The other one is the role of telemedicine. Telemedicine has become a very critical tool in expanding access to healthcare in Nigeria, especially in areas that would normally not have access to good primary health care or doctors or even nurses. So these people can benefit from telemedicine by providing consultation via phone calls and via video calls. The new one that is in trend now is AI. Everybody is now talking about AI and big data. How can we leverage AI? An example is that of Google. Google built a tool that can guess the population that's going to have retinopathy because of the number of data they've gotten from AI. So that meant that industries that could have access to this data could quickly understand potential challenges that could come with from their population, especially when it comes to health. Same thing, AI is providing us opportunity to be able to identify at-risk population, to be able to analyze and see how uninsured people can be insured and what they are at the risk of the most. Also, it allows us to be able to be proactive with health solutions, and these proactive models can be used to forecast medical emergencies in specific region. How can we then improve providers' efficiency? The first one is that of electronic health records. Complete Care has made a very amazing presentation, like I mentioned earlier. Electronic records, health records are super important. For most of our public health institutions, when you get there, you still see a lot of case notes, handwritten case notes that health assistants have to carry from one part of the hospital to another, and a lot of records are lost in between all this. With advent of electronic health records, it makes it possible for us to transform the way healthcare providers manage patient information. Digitized records make it accessible real time, and it can benefit care coordination. It can help reduce medical errors because it provides accurate information and up-to-date information, and it also allows for better data analysis to track health trends and outcome. Another company that's doing that currently in Nigeria is Ilium Health. Ilium Health also provides services for electronic health record. And also, Lagos State is already taking the right step in direction for that with Lagos SHIP, which will allow public institutions to be able to actually digitize health records of patients that come in there. The other one is automated claim system. If you have ever had the need to use insurance, there are so many times where you will have to wait. They will tell you, please wait till we are calling your HMO. And sometimes you wait for hours. But with automated claim system getting more and more digitized and the processes are becoming seamless, it's going to make it faster for us to process and reduce waiting time to access care from weeks to days to hours to minutes. And it will also improve transparency in the claim status of people and also be able to identify truly if someone truly have access to that benefit, and it will reduce paperwork and administrative workload. Like I used to say, we have at our company, we have one of the most comprehensive claim management systems in Africa. And that is because we've been able to see and look at our processes end to end, such that when people need to use our service, they hardly wait. They just go to the pharmacies, which are most of our partners, to pick up their medication. And also, AI for clinical decision support is an important one. And this can help us to be able to do more, especially with at-risk population. The next one is mobile health and health platforms for providers. Mobile health platforms provide doctors with tools to monitor patient health, access records, and collaborate with other healthcare providers all through their mobile devices. And this allows to be able to monitor people that would normally not have access to tertiary, even primary healthcare institutions, especially people in underserved areas. An example is Omomi, which allows mothers to be able to have access to O&G doctors in remote areas. Also, health information exchanges. It's very important that when people move from one healthcare point to another, they can carry their data and health records along with them when they are moving. So health information exchange is very important. Lagos SHIP is solving this problem because it will mean that data information about patients is now centralized. But also, one example is that of Singapore strategic vision for one patient and one health record called Synapse. Here, they've made sure that all the citizens of the country have a single health record in a single place. So as we keep getting more information about Nigerians from our data, from our national identity number, and all those things that can be tied as a singular record for a person, more innovation can be built around it such that not just our financial record can be accessed by anyone. Also, our health record should be something that can easily be accessed whenever there's an emergency or we've gone to a place where we need care. It will be easy for our health record to be taken and proper management will be done for such person. Part of benefit that comes with health insurance is that people get prescriptions every time. When you've spoken to a doctor online through telemedicine or you've actually gone to the clinic, you will likely be prescribed medication. Now, digital prescription platform is now allowing healthcare to be able to provide medication electronically and link patient directly to pharmacies for fulfillment. So part of that solution that we built, for example, at Wellite is called WeFeel. With WeFeel, there's a digital platform that HMOs can just log in onto and request for medication. And patients can easily go to any pharmacy or request that medication be delivered to them. Also, HMOs, when they've told patients, talk to patients via telemedicine app and medication has been prescribed for them, rather than the patient taking the sheet of paper to a pharmacy to get medication, they can easily help them fill this prescription by sending them to a pharmacy or delivering this medication to them at home. There are a lot of differences between what traditional HMO and InsurTech is doing. But like I've mentioned, a lot of those things. But the most important one here is scalability. For companies that are becoming InsurTech companies, it's way faster for them to scale, way faster for them to get access to more patients, way faster for them to reach more people, faster for them to access, to provide faster care to people that are their enrollees. Their partners are also going to benefit from this because if you've digitized the system that your partners are using, it makes life easy for everybody. So rather than people carrying paper from one point to another, making calls every time, imagine just getting notification that you can just click and things are just smooth. Right. So what can we do now to make things better? We need to encourage public-private partnerships in tech-driven healthcare. Private technology companies are nimble and faster than public institutions. And it's very important that governments and people in the public healthcare space, especially people that are controlling it, they help bring innovation and expertise and collaborate with these companies. It's amazing what Lagos State did with partnership with InterSwitch for Lagos SHIP, right? And there is a lot more that can be done by collaborating with existing technology companies to be able to solve all this problem. By partnering with the government and healthcare providers, these tech companies can offer scalable solutions that improve enrollment, data management, and service delivery. Also, government should endeavor to make policies that support digital innovation in health insurance. The government needs to encourage digital transformation. They need to provide the environment that fosters digital health. Policies that will incentivize technology adoption for healthcare providers, for health insurance, and things like tax breaks or grants for healthcare startups should be done so that we can continue to incentivize these people to grow, right? Another one is data privacy and security regulation. The NDPR is such an amazing feat, and it has allowed us to be able to protect patients more, especially because information can now be shared easily online. So strengthening this regulation will definitely boost trust in digital platforms that are available. The other one is national health strategy alignment. The policies should align Nigeria's national health strategy to integrate digital health solutions with the national health insurance scheme. And this is happening. As time goes on, we are going to see more unified systems that are helping to build access to all the amazing, important digital tools that have been provided for healthcare. And above all, capacity building. We need more people to be involved in technology. I'm lucky to have met my CEO, for example, that opened my eyes to be able to see what is possible to do in healthcare with tech. And lots more people like that need to be trained. So the Nigerian government should help ensure that more and more people are trained to become tech doctors and tech nurses and tech medical lab scientists that are using leveraging technology to be able to grow things. There are amazing examples of this all over the world. I'll mention two here. In Kenya, there's a tool called MTBA. MTBA is a mobile-based health financing platform that allows users to save, send, and receive funds for medical treatment. And this platform is actually integrated with hospitals and clinics to provide seamless insurance services. And one of the stories that I would like to tell recently was how, at Wellite, we realized that whenever we go to market and try to sell to market women, all of them say, no, we don't have money. We don't have money. So we thought about it. What can we do to make sure that these women, even just for them to regularly check their BP, regularly check their blood sugar level, we help them to be able to mitigate against terrible diseases that could take away their livelihood and money at some point. So what we did, we started building a tool for agents. So we called them Wella agents. These people actually dress with some bags containing things like Sphig and blood sugar level tester. And we basically just go to market every day with their enrollment tool. And these people collect 50 naira, 100 naira every day towards a contribution of 400 naira per month for these women. And we've seen a surge in enrollment for these people. So like I've said, it's very important to look at the environment and start innovating around how people already behave, what people already do regularly, so that we won't be innovating and bringing foreign solutions that might not work for our environment. Another example is that of Matsuo de Santi. This particular solution was done in Rwanda, and what they did was to create a community-based health insurance scheme that uses digital technology to manage patient records. So basically, they went to communities in Rwanda and said the chiefs in those communities should be caretaker of their health insurance. So people in the community actually contribute regularly to a fund for them to be able to access healthcare in that community, because they've seen how they actually already contribute together every time. So all of us can look at places like cooperatives, clusters where people meet, drivers association, market women association, where people already exist, and see how we can provide them with simple solutions that will allow them to be able to actually pay for health insurance and actually be able to access it. As we keep doing all these things that we've discussed, digital technology will revolutionize Nigeria's health insurance. It will improve our access and efficiency, and it's time for all of us to embrace this transformation to achieve better healthcare for all. Thank you.
Thank you so much, Dr. Jephthah Aliton. Another round of applause for him. Yeah. While we are still waiting for the Honorable Commissioner for Health, Lagos State, I think we have a product presentation by Silky Nigeria Limited. If they are ready, can you please come up? You have 5 minutes to do that. Thank you.
Your name? Onassis.
Okay, the presentation is going to be made by Onassis. Thank you. 5 minutes. Your time starts now.
Good afternoon, all.
Just a moment. Just a moment. Please, just before that, we have in our midst the President, HCPAN, Dr. Leke Osuniyi. You are most welcome, sir. Also, we have the Deputy Director, Enijahe Ikeja, Mrs. Evelyn Nwodo. You are most welcome. Equally, we have the MD Hallmark HMO, Dr. Dotun Adeogun. Thank you so much, and you are most welcome. Mr. Onassis, you have the mic. Thank you.
Thank you once more for this opportunity. My name is Onassis once more. I represent HCPAN Limited, also called Nature's Field. We are here to just present briefly our brands. Okay. Okay. We're looking at the categories of people that need supplements. We're looking at the age range from children.
While Mr. Onassis is trying to make the presentation from Nature Feed, we have the Honorable Commissioner of Health, Lagos State, and I have the singular honor to introduce Professor Akin Abayomi. You are most welcome, sir. We can actually do better. Another round of applause for him. You are most welcome, sir.
Okay, thank you very much. Welcome, sir. Like I said, we're going to talk briefly on our Nature Feed brands. We are looking at what are the categories of we're looking at the different health categories that Nature Feed brands covers. We're looking at the sexual health, which includes our Adam Desire, our Tonga, our Eve Desire, our Men's Zone, and our Maka. We're also looking at the reproductive health, which our brands also covers. We are looking at the Pregmom, the fatty support for men and women, the Follobeam. We also have our hormonal wellness health section, which also covers the evening primrose, the Menoise, and Vitex. They also covers the bone and joint health, which also includes our joint renew ranges, our joint renew advanced, our joint renew maximum strength, and our plain joint renew. We're also looking at our magnesium and calcium, the mega calcium. We're also looking at the vision health that we covered also. That's where we have our key brand, which is called the iCap, and our eye brights. They also have a general wellness section, which also covers the men, the healthy men ranges, the healthy men for women, healthy you men for women, 50 plus, and also the below 50. We have the children's health section, which covers the healthy you kids. We have the branch that also covers the urology health, where we have our prostate defense for our urology health. We also have the subpalmetto ranges. Then we have the one that also for the weight management, which covers our short slim fat burner and our ordinary short slim. Then we have the stress categories. That's where we have our stress defense. Then we have our sleep aids, which we have the calm nights and the melatonin ranges. Then we have our cardio health. That's where we have our cardiovits and other ranges in that category. We also have our diabetes management health. In that range, we have our DIAK. In all, we have over 130 brands in our ranges of products that covers from your head up to your toe. We also have the brain health. That's that here we have our memory cap. We have the immune health. We have our immune defense advance, our plain immune defense. We also have our vitamin C's. We also have our zincs also. Then in our beauty corners, we have our beauty shows ranges and our maxi boss ranges. Then in all, we also look at a wide range of categories of health supplement that we cover. Just like I said, from your head up to your toe, we cover them all. If you have time, maybe at the break time, you can visit our stand at the back there, where we explain better more of our ranges. Thank you very much.
Thank you, Nature Feed. Another round of applause for him. Yes, we have the sub-team presentation, that is the State Health Insurance Scheme, sharing experience and adopting best practices. Representing the ES LASHMA, that is Dr. Emmanuel Samba, is Dr. Adetoro. She's going to mount the podium to give a presentation on behalf of the ES Samba. Ladies and gentlemen, please welcome Dr. Adetoro. So Mrs. Tayo Adetoro is going to present the sub-team by Dr. Emmanuel Samba. Thank you. Our presentation.
Thank you very much, sir. Good afternoon, everyone. I want to stand on existing protocols, and I'll try and make this very fast. The good thing is that the speakers that went ahead of me have done a very good job on explaining the digital technology and why we should have it. So I will just try and share what we've been doing in LASHMA over the years, how we've leveraged on technologies, the best practices, and our experiences. We're all aware of the LSHS law. Okay, so the LSHS law is where what's brought about the agency, and it's made it mandatory for all residents of the states to have to be enrolled. And this is what's brought about LASHMA and the Lagos State Health Fund. The Health Fund, LASHEF, is where the funds go into. Next slide, please. These are the objectives of the LSHS law. I don't want to dwell so much on it. But basically, it's to make sure that all residents of Lagos have access to quality and affordable health care, and that they do not have any catastrophic experience while trying to access this care. It's also to try and reduce out-of-pocket expenses. So we'll also like to touch briefly on the NHIE Act. The major components of the Act that relates to us is where it says that the state should establish an SSHIS, which is LASHMA in our state. And it says that it's mandatory that every resident of Nigeria subscribe to the state health insurance scheme, which is Ilera Eco in Lagos. And it also says, and then part of what we did to domesticate this is the executive order which Mr. Governor signed recently in July. Next slide, please. So the health insurance processes, this is what it looks like if we are relying on a lot of manual processes. Firstly, it is very inefficient. It's time-consuming and very labor-intensive. It means that we'll be making errors if we have to. So, for example, if we have to say who are those active for the month, it means someone will sit down with a bunch of papers and begin to look at forms one by one. When did they pay? When are they active? Which alludes to the fact why we have to leverage on technology. And then the mandate given to LASHMA from day one was to ensure that all residents of Lagos State have access to health insurance. It means that we were thinking scale from the very beginning, and there was no way manual was going to deal with the kind of scale we're trying to achieve. Also, providers need to be paid they need not only the correct amount, but also be paid in a timely manner, because they have to have funds to keep running their businesses. If we have to rely on manual payments, manual processing, this will delay this process. And there's a lot of data breach and security risks that can happen if we are transferring data up and down in manual. Sensitive information might be lost or even stolen. There's also restricted access to this information. You cannot get information as at when you need it. And let me not talk so much, but you can imagine the kind of space that we need to be storing 1 million forms by now, the kind of large size of enrollees that we already have on the scheme. Next slide, please. So what are some of the best practices, and how is LASHMA keying into that? Enrollment and registration portals, we have that. Automated payment system, electronic medical record system, a claims management system, mobile applications, online help desks. We already have our chatbots in process, not yet completed, but very soon. We also have blockchain for secure data storage. We do a lot of data analytics and use business intelligence tools for this. We also rely on cloud-based infrastructure, and we use fraud detection tools while processing our claims and other things. Next slide, please. This is what the agency looks like. We have 3 major arms. We have what we call LSHS regulation that is involved in implementing the mandatory nature of the scheme. And we also have what we call ECOSHA. That's the resource mobilization arm for the vulnerable, Eco-Social Health Alliance. But the main arm that we are all aware of here is Ilera Eco. And that Ilera Eco has 2 sides to it. You have the demand side. That is where we are bringing up enrollees on board. And that speaks to the team that we have today, which says how to enhance enrollment. And then we have the supply side, which is where we purchase the services from the healthcare providers. And it also speaks to the team today on efficiency of the providers. So I'll try and run through what we do on both sides of this, all the arms that I've mentioned in terms of technology. On Ilera Eco, these are some processes. Next slide, please. You see about 12 processes that I've listed here. I will not read them out because of time, but I'll talk about some of them. Next slide, please. On the enrollment, we have a lot of digital enrollment channels. We have online portals, web, mobiles. We have mobile applications both on iOS and Android. We use USSD codes. We use QR codes. We use a lot of social media platforms and third-party agencies. For the process, the person just needs to fill in their basic information. They select the plan. They select how they want to pay. Do you want to pay quarterly, biannual, or annual? the system automatically bills you based on what you register for, and then you are able to pay for that. And if a group of people are coming where we have a bulk upload, what we call bulk upload, that you cannot be entering the data sets one by one, we have a preset format where we can do bulk upload for registration. And we made payment easy because we want to tie, it's best, you cannot at the end of the month begin to look at your bank statement and trying to tie it to registration. So it's such that once you complete the registration, you are able to make payments based on that registration using your unique enrollee ID, and it immediately ties it to your plan and activates your plan accordingly. This payment, they're either bank transfer, mobile money, USSD, or even the voucher. And they are very secure gateways, very convenient, and there's also real-time confirmation. Some of the features this uses are the real-time eligibility verification. We are able to upload passport photographs digitally. The enrollees get SMS notification. They're able to track their payments, and then our system is integrated with the Lagos State Residents Registration Agency. Next slide, please. This is what our web registration looks like. Next slide. Our enrollment portal. If you're an enrollee on Ilera Eco, you can dial the *6700*006# for our USSD option. Next slide. This is the QR code. You can scan it. It takes you straight into where to enroll. And these are some of our payment channels where we launch the voucher and some other payment channels. Next slide, please. The LASRA partnership, LASRA is Lagos State Residents Registration Agency. That is a gateway for residents to access so many things. So we have integrated with LASRA so that you can use your LASRA card to also access care. And then the LASRA locations are also additional locations to register for Ilera Eco. We believe that this collaboration will increase awareness and registration. Next slide, please. Every customer has access to download the customer app, and the customer app also serves as an ID card. There's an ID card portion on this customer app. The enrollee is able to do a lot of things on their own via the customer app if they are that learned. Okay, next slide, please. On the supply side, these are also some things that we are able to do on the supply side. We are able to check eligibility of enrollees, the claims management system, pre-authorizations, referrals, claim submission, processing, EMR, and we also have telemedicine. When an enrollee walks into any Ilera Eco hospital, they are able to check on our system if the person is the person standing in front of you first, and also if the person has an active plan. Also, for every treatment the person receives at the hospital, once it is keyed into our claims management system, you are able to request for pre-authorization. You are able to key in the request for pre-authorization where required. If you need to refer the person for secondary care, you are also able to do that on the system. Submit your claims on that same system. So at our own end, because all this have been done on a system, next slide, please. Capitation payment is easier to be done. The claims processing is also easier to be done because we also use, that's where we use the tools, rules-based systems to adjudicate the claims, and this minimizes errors. And then we're able to process claims and pay out fee-for-service claims to the providers. And these are some of the technology-enabled features of these provider payments. Next slide, please. We also realized that it's also a very key thing to have an EMR CMS, that's the claims management system interoperability, because it makes it easier for the hospital to key in the visits from the beginning all the way to the end without having to duplicate the effort. So what we did at Ilera Eco was to ask our providers, if you do not have EMR, we actually went a step further and provided EMR for those who didn't have. There were 53 at the time. And now, going forward, anybody that wants to join Ilera Eco, if you do not have an EMR, we would register you. We would onboard you on this. We will deploy the EMR to you during the onboarding process. Next slide, please. Ilera Eco also has what we call the drug access expansion. what that did was thought that enrollees had access to more places to get their medications from. Although we still say that the first point of care is the healthcare provider. They still have to walk into the healthcare provider. For any prescription given to them at the healthcare provider, due to technology, the community pharmacist can't see the prescription at their end. If the enrollee walks into any of our participating community pharmacies with their enrollee ID, the community pharmacy picks that prescription, dispenses the prescription, and closes out the prescription. The community pharmacist is also able to make claims for that dispense through the technology that we have provided. Next slide, please. I talked about telemedicine. This is how we started. We started during the COVID, and right now it has evolved into what we call Ilera Eco telemedicine. Next slide, please. So these are the components of the telemedicine. You can either call the toll-free line, you download the telemedicine app, or you walk into any of the virtual booths. We have 5 of the booths currently in Lagos, and we are expecting to spread this to 300 locations. Next slide, please. This is what the Ilera Eco telemedicine app looks like. It's available on our Google Play Store. Every Ilera Eco enrollee on Standard JARA has access to Ilera Eco telemedicine. Next slide, please. This is what the exterior of the Ilera Eco booth looks like. I don't know if any of us have seen it anywhere in Lagos. We have one at K2 Market, the K2 bus stop. We have one at Adamo Market Ikorodu, Sabo Market Ikorodu, Sabo Market in Yaba, and then the Ayetoro Market in Ekwe. And like I mentioned, we'll be having about 300 of these all over the states. Next slide, please. This is what the interior of the booth looks like, where the patient sits, where the enrollee sits there and can access a doctor via telemedicine. Next slide, please. These are some of the services at the V booth: blood pressure, blood glucose checks, prescription, referrals, health education, and the likes. Next slide, please. Okay, so finally, our LSHS regulations, the ARM meant to implement the mandatory nature of the scheme. This is a bit of what they do. Next slide, please. They ensure that they issue the guidelines and regulations. They also make sure that corporate organizations register for the corporate identification number. And these functions are done on the regulatory portal. Next slide, please. This is what the portal looks like. And next slide. Let me just also mention here that part of what the executive order says is that every MDA and even healthcare facility, when a patient walks into the facility, you must request for proof of Ilera Eco plan, except in a life-threatening emergency. So how do you check that this enrollee is truly covered on Ilera Eco? You can use the enrollee's phone to dial the USSD I talked about. You can also look at the Ilera Eco customer app. But you will agree with me that the fact that you have to rely on what the enrollee brings might not be as foolproof as you checking. So this is why we have what we call the verification slip. It's a web-based verification status tool where you type in the enrollee's ID and it brings out the kind of certificates that you have there. That is my certificate that shows that I am compliant. I thought you would clap for me. I have my own verification slip and compliance. And so this is what that verification portal looks like. The next slide. And for the EcoSha, that this is rounding up here, the Eco Social Health Alliance I alluded to, they are the ones responsible for enrolling the vulnerable. The Lagos State already has what we call the Equity Fund allocated for the vulnerable amongst us. EcoSha also tries to raise some funds. And the executive order I alluded to earlier also said anybody that is vulnerable should be enrolled using the equity fund. So how do we know who is vulnerable? How do you scientifically, or rather objectively determine that this person is vulnerable? Which is why we have what we call our vulnerable identification tool. It uses multidimensional poverty index to create the vulnerability index of the respondents, and anybody that is classified vulnerable is automatically enrolled into Ilera Eco. And The benefits of digitalization, efficiency, scalability, faster payments, which I know providers want, transparency, data protection, increased accessibility. Everybody's happy, the customers, the enrollees, the healthcare providers, everybody's happy, and we're able to detect fraud, and most importantly, cost savings, so that we have enough for patient care. In conclusion, Lashma has embraced digital technology from inception to increase enrollment, and will continue to adopt and integrate these tools to overcome whatever challenge, and will continue to evolve to utilize the power of digital technology to create a more efficient, equitable, and patient-centered health insurance ecosystem that benefits all residents of Lagos State. Thank you very much. How many minutes?
Thank you so much, Mrs. Adetoro. That is the address by the ES LASMA, Dr. Samba, ably and unarguably ably presented by Mrs. Adetoro. The next person to give us and share our experience supposed to be Dr. Jetawo, but we want to take the Honorable Commissioner of Health Lagos State, and we are getting ready for the presentation slides by the ICT team to be made available. While waiting for the IT team, let me just read the abridged profile, the citation of the Honorable Commissioner of Health Lagos State, Professor Akin Abayomi, OON. Professor Akin Abayomi, sir, your citation, sir. Professor Akin Abayomi is a specialist in internal medicine, hematology, biosecurity, and environmental health. He received his first degree in medicine at the Royal University of London with fellowships from both Royal College of Medicine and Pathology in the United Kingdom and the College of Medicine of South Africa, respectively. He also has a master's in environmental ecology from the University of Pretoria in South Africa. Professor Akin Abayomi has been exposed to a vast variety of geographical variations in disease patterns within the field of internal medicine and hematology, having worked in the UK, Nigeria, the Middle East, the West Indies, Zimbabwe, and South Africa. Professor Akin Abayomi is serving a second four-year term as the Honorable Commissioner for Health in Lagos State, in the Lagos State Executive Cabinet of His Excellency Governor Babajide Sanwo-Olu. Prior to this, Professor Akin Abayomi was Professor of Medicine at the Nigeria Institute of Medical Research in Lagos, Nigeria, and before that, the Chief Pathologist and Head of the Division of Hematology at the University of Stellenbosch Faculty of Medicine Sciences in Cape Town, South Africa. Professor Akin Abayomi has published over 70 scientific peer-reviewed articles and book chapters in his medical career. He is the founder of the Global Emerging Pathogen Consortium, also known as GET Africa, which was entrenched at the peak of the Ebola outbreak in Lagos State to address biosecurity concerns in Africa. He is also the honorary professor to the Center for Biosecurity Studies, University of the West Indies, Cave Hill Campus, Barbados, Caribbean. Professor Abayomi is a fellow of the African Academy of Science and a recipient of the National Productive Order of Merit Award, NPOM, and an officer of the Order of the Niger, OON. As confirmed by the President of the Federal Republic of Nigeria in recognition of his excellence in the field of medicine and his high productivity, especially in the role he played in the expert containment of the COVID pandemic in Nigeria. Professor Akin Abayomi plays lawn tennis, ride horses, and in his more agile years, played polo for the Kaduna and Ibadan Polo Club. Professor Abayomi is an avid environmentalist and maintains a large nature conservation called the Emerald Forest Reserve, situated at Ikoyi, Osun, near Asejire Dam on the banks of the Osun River. Ladies and gentlemen, I present to you Professor Akin Abayomi. Let it go, 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 let it go.
So good afternoon, everybody. And let me apologize for coming late. I was at another event with members of Cabinet and His Excellency. I had to leave that event to come here to be with you and to share and listen to some ideas. But I also have to leave you again at 1:45 because I have another delegation waiting for me at the ministry. But let me first of all congratulate HCPAN for your 2024 scientific conference and annual general meeting. I can see it's well attended, and I've seen some very familiar faces in the audience. But let me first acknowledge the president, the national president of HCPAN, Dr. Austin Aipo. Thank you very much for inviting me. The immediate past president, Dr. Jimmy, thank you very much. And the chairman of HCPAN Lagos host, pharmacist Biola Paul Ozier. Thank you very much for inviting me here to talk about a subject matter that is rapidly evolving, very dynamic, and has the potential to change the face of how we practice health in Lagos, at least, and hopefully Nigeria. I don't know, do I have a slide changer? So I can't actually see what you're seeing, but I'm going to guess. Thank you. Are you looking at my first slide? Does it have my name on it? Okay. So I've been asked to talk about understanding the new social health insurance executive order for all-inclusive social health insurance in Lagos State, a public-private partnership for change. Can you see my next slide? Does it have pretty pictures on it? Okay, so the Lagos State Health Insurance Scheme is operated by LASHMA, or the Lagos State Health Management Agency, which is Lagos State government's arm of delivering health insurance to Lagosians. The mission, the essence of the Lagos State Health Insurance Scheme as an executive order to create the opportunity for collaboration and ushering in the desired changes. Can you see a slide saying the key essence of the executive order? Okay. So to ensure that all residents of the state have access to healthcare services, to ensure that all residents of the state have financial protection, physical access to effective, quality, and affordable health services to protect families from hardship and to ensure equitable distribution, to maintain a standard of healthcare delivery services within the scheme, and resetting the economic clock of healthcare delivery. Now, this is actually the crux of the matter, and I want you to keep paying attention to this thematic sentence: resetting the economic clock of healthcare delivery in Lagos. So what are the causes of brain drain, reluctance to attract brain gain, and the incessant outbound movement of medical tourism? So there are a number of factors that are contributing to this. We do not have enough training posts in Nigeria to make different cadres of medical professionals at both undergraduate and postgraduate level. There is insufficient diversity of specialists and subspecialist experts and the requisite infrastructure to deliver the full spectrum of healthcare delivery in Lagos. And the financial structure of the Lagos health sector operates outside of the mainstream economy. In other words, the health sector is not really contributing as much as it should to the GDP growth of Lagos State as a direct financial input to the economy. The financial structure of the health sector is not properly regulated, and there is an excessive reliance on out-of-pocket expenditure. To usher healthcare into a more prominent position in the mainstream economy, we have to do a number of things. We have to improve and harness private sector participation in the provision of healthcare. We have to ensure adequate distribution of quality healthcare facilities within the state. We have to ensure appropriate patronage of all levels of healthcare delivery systems. We have to ensure the availability of alternative sources of funding to the health sector for improved delivery and keeping it buoyant and vibrant. We need to be able to plan, organize, and develop a full spectrum of healthcare services for residents, both in the public and in the private sector. And this will retard outbound medical tourism. And we need to be aggressive about retarding brain drain and promoting brain gain. Modalities for ushering healthcare into a more prominent position in the mainstream economy. Is that the slide you're seeing? Okay. So government, as well as its private sector partners, we need to transform Lagos into a cashless health transaction ecosystem. When you go to more developed environments, it is very rare for you to present yourself for healthcare and pay for your services out of pocket, either by cash or through some electronic transaction. Most places, you appear for healthcare delivery and you put one or two cards on the table, and your health insurance protection will take care of your expenses. It is important that we must ensure that each healthcare facility will be entitled to a variety of automatic models of capitation payments, thereby injecting finances into the sector automatically, whether or not a patient presents for care. We must improve our facilities. Stimulating the health in the mainstream economy will improve services at facilities and who will now be competing for patronage. The Lagos State government, through accreditation of participating HMOs, can regulate the compliance with premium tiers developed by the sector based on actuarially realistic analysis. In other words, we are relying on the sector to develop the tiers of premiums based on science. And it is the responsibility of government and the private sector to ensure that we collectively and collaboratively comply with these developments. What are the challenges? Lagos State has over 25 million people. The informal sector comprises of about 80% of the workforce. Unemployment is high, and the poverty rate is high, estimated at 66% when we use the less than $1.25 per day. But with the fall of the naira, I guess more people have fallen into this bracket. And you can see on the pie chart there the distribution of the workforce in Lagos, with the majority of Lagosians in the informal sector. A sizable number are unemployed in red. There is the organized private sector, and then there are civil servants. And so you can see that there are significant challenges here, which I'm going to allude to in a second. But let's look at our indices for a moment, and this is the responsibility of government. We have very high maternal mortality. You all know the figures. We have high under 5 mortality. We have high infant mortality. We have neonatal mortality, some of the worst in the world. And these are the indices for Nigeria and for Lagos. And even more shocking, 16% of our children suffer from wasting. And the data suggests that over 30% have stunting. And this kind of data we see every day as data belonging to this country. Now, we've done some analysis, and this is the sort of breakdown of the health sector in Lagos. And out of about 4,000 healthcare facilities made up of hospitals, maternity homes, convalescent homes, clinics, and laboratories, about 2,000 are registered on the DHIS. In other words, the Ministry of Health can access data from these facilities. And of these 2,000, about 370 are in the public sector, in other words, PHCs and general hospitals, and about 1,700 are in the private sector. And you can see that there's a significant difference between the quantitative parameters of healthcare delivery in Lagos. And when we look at the DHIS data, we see something that is a little bit surprising. We see that in a recent study from 2023 data, that majority of the entry is from the public sector, with 66 or 60% of 12,000 entries being collected at the public facilities and 27% at private facilities. What does this actually mean? Well, we're not quite sure. It might be that most Lagosians are accessing their health. If they are going to a medical facility, they are going to the public sector. We do know that a lot of Lagosians don't actually come to medical facilities. They go to other forms of healthcare, task shifting kind of opportunities. But it may also mean that we're not collecting this data accurately and that there is a paucity of entry in the private sector. Notwithstanding, that is our data. So we come to the issues of health insurance. And the challenges of health insurance, particularly social health insurance for us in Lagos, are numerous. Our citizens lack an insurance culture. In other words, whatever the case may be, we prefer to wait till there's a need before you secure some kind of advanced protection against a shock, whether it's a car accident, a catastrophe at home, your life, or your health. And so it's important for government to start to introduce and to promote the concept of insurance, not just for health, but across the board. We also have a very high informal sector that I spoke about. In Lagos State, the informal sector employs about 5.5 million people, and this is responsible, according to the Commissioner for Commerce, is responsible for 75% of Lagos State's GDP. So this sector is actually a very important and huge sector. But the informal sector is difficult to track and is difficult to extract insurance from this kind of sector. The third problem is that our primary healthcare facilities, both in the public and in the private sector, are not exactly where we want them to be in terms of infrastructure, quality, and human resources. And so we need to work harder, both as government and as private sector, to ensure that we have better facilities that attract our citizens, so that when we are pushing the concept of insurance, we're not pushing something that is not encouraging for them to utilize. Similarly, in 2023, we did a survey and we demonstrated that awareness around social health insurance is not bad. Out of 13,000 respondents, 8,000 said they've never heard of our social health insurance. About 0.5% said they were not sure. But a respectable number, 40%, or 5,000, said they were familiar with Ilera Eco or the Lagos State Health Insurance. The study went on to try and understand the factors limiting participation in Ilera Eco. Out of 3,000 plus respondents, about 1,000 said they lacked information. Another 1,400 said they had limited funds to enroll for an insurance scheme that is 8,500 naira per year. That comes as a surprise. About 1% or 2% said they didn't want to enroll for insurance reasons, and a variety of other excuses. But a sizable number of 22%, and this is the point I was alluding to, that we don't have a culture of insurance, said there was no incentive for them to join an insurance because I guess they felt they were well. And so we look at the spectrum of Lagos State and we look at the good and the bad. The good is that Lagos State contributes almost 30% of the national GDP. estimated at about 14 trillion naira. There's a 3,000 population growth per day. And so Lagos is a city that will not stop growing. The informal sector is 80%. The problem with the informal sector are twofold. First of all, it is difficult to extract tax out of the informal sector, but it's also difficult to pull in informal sector into the insurance paradigm. And then we have a significant amount of unemployment. So what is the potential? Can you see a map of Nigeria with 27 and 41? Sure? Okay. So, Nigeria is a vibrant, Lagos is a vibrant megacity. It is the economic hub with huge potential for a vibrant and sustainable health sector. Its GDP has grown in the last 4 years from 27 trillion to 41 trillion under the leadership of Governor Babajide Sanwo-Olu. That is an impressive growth of GDP. It is strategically located. It has a vibrant population. It has a diversified economy. And let's look at the attributes of this 41 trillion naira economy. As I said, it contributes to more than 30% of Nigeria's GDP. It consumes 60% of Nigeria's energy, accounts for 90% of Nigeria's foreign trade flow, generates over 50% of Nigeria's ports revenue, and 70% of the state's revenue is internally generated. So in Lagos State, micro and small to medium enterprises are essentially the bulk of the informal sector and contribute to 75% of this $41 trillion GDP economy. So, by all intents and purposes, Lagos is not a poor state. Lagos is a vibrant economy. There is no reason why Lagos should not, its health sector should not be part of this vibrancy. And so what are the potentials? In the Lagos State's 30-year development plan, and I'm not sure that you're aware that Lagos State is actually the only governed space in Africa, at least in sub-Saharan Africa, that has a 30-year development plan. It's called the LSDP 2052. Is that what you can see on your screen? Can you see it now? What can you see? The Lagos State Development Plan 2052. This is a very large document. It was developed 2 years ago. If you don't have it, you just go online and just type in LSDP 2052. It will come up. You should download it. And inside here, we have the 30-year development plan and the health sector component. And I'm just summarizing that there are two major components of the health sector. The first is that we should achieve universal health care coverage by 2052, complete, and we should become at least in the top 3 destinations for medical tourism in Africa. But let's really unpack this situation. We talk about catastrophic health expenditure, which takes our citizens from poverty into penury. Penury is a very deep form of poverty. Catastrophic health expenditure is defined as when the expenditure on health is more than 40% of a combined household income, less cost of feeding. So if a household has a monthly combined income of 100,000 naira, equivalent to 1.2 million per year, and you remove feeding, which can be as high as 50%, it leaves you with a balance of 600,000 naira for power, transport, clothes, recreation, savings, and health. If all of a sudden this family, for example, the wife is pregnant and she goes to hospital and she goes into prolonged labor and she has to have a cesarean section, the bill for that could be on average about 400,000 naira. That is 66% of the balance. And it is equivalent to catastrophic health expenditure because that family will not be able to spend money on anything else for the rest of that month. So when we come to the pie chart that I showed you earlier, is that what you can see on your screen? Yes. We can see the spending healthcare expenditure. You can see that Nigerians spend 4% on health through insurance. There's an additional 4% from donors. Government spends 19%. And 73% of Nigerians are spending health from their pockets. So what we're trying to do in Lagos State is to move this dial on two fronts. In terms of insurance, with the yellow arrows, we're trying to get more and more people enrolled into insurance, either social health insurance or private health insurance. So we want to diminish the number of people that are spending for health out of their pocket. At the same time, on the other side, we want to increase government spending on health with the orange arrows. And eventually, we want these two arrows to meet at the green arrow, at which point those who are employed will all have a yellow arrow. And everybody who is employed will have some form of insurance. And the government will be responsible for the vulnerable. And thereby, everybody will be catered for. And there will be some form of cross-subsidization between private sector, public sector, the wealthy, and the underprivileged. The idea is that the utopia is the green arrow, where there is nobody in Lagos that is actually presenting for health and spending either out of pocket, but rather that your health is covered either by an insurance or some kind of social safety net provided by the government. So what are the solutions? The data we have at the moment suggests that about 1.8 million Lagosians are insured privately through our HMOs. The data we have from Ilera Eko, Lashma, shows that about just under 1 million active enrollees, which includes about 350,000 civil servants. And the rest are comprised of vulnerable populations covered by BHCPF, Equity Fund, and then voluntary enrollees. Therefore, about 2.8 out of 25 million or 30 million Lagosians have insurance protection. Enter the NHIA law, or the NHIA Authority Act, which was signed, is that what you can see on your screen? Signed into law by President Muhammadu Buhari in 2022. The Act seeks to promote, regulate, and integrate health insurance schemes and establish universal healthcare coverage for all Nigerians. The important part of that act is in red. Under the old act, subscription for health insurance was optional. Government has now, through this new act, made insurance mandatory. And this is critical for us in Lagos. And we've been waiting for this law, either from the federal or from the state level, for a long time. And so we seized the opportunity. And Mr. Governor, with his wisdom, decided to domesticate the NHIA Act immediately. And we've been working on this for about 18 months, finally resulting in the executive order of July 2024, which domesticates the NHIA in Lagos. The principle is that it is now compulsory to subscribe to social health insurance by all residents of Lagos. In other words, if you are living in Lagos, you are participating in the economy of this great state. You are enjoying the attributes of a mega city with a GDP of 40 trillion naira. It is your responsibility to carry a minimum of social health insurance in your pocket. So let me go through the attributes of the executive order. Can you see 1, 2, 3 on your slide? The first attribute of the executive order is that all agencies of the Ministry of Health, and particularly LASHMA, will carry out a massive public health awareness campaign on the significance of social health insurance in particular, and private health insurance in general, for the purpose of achieving universal healthcare coverage and restoring healthcare into the mainstream economy. This will include the reorientation and mind shift of healthcare providers away from the expectation of out-of-pocket spending to health insurance financing, capitation, and fee-for-service for care provided. Did you get that? Shall I read it again? Is it clear? Okay. Number 2, the Ministry of Health will intensify its engagement with the HMOs to advance synergistic opportunities that will harness and resource the resources of both public and private insurance agencies to synchronize social health insurance and private insurance for the comfort and convenience of the public. To do this, and what this actually means, is that while the executive order says that social health insurance is mandatory, we fully understand that there are about 1.8 million Lagosians who are carrying private health insurance. And it would be very inconvenient for them to now, because of a law, have to go and enroll in LASHMA for the Ilera Eco while they have their own private health insurance. And so what we're going to do through this PPP partnership is that if you own a private health insurance, it is more than likely that your private health insurance covers all the aspects of Ilera Eco. And therefore, it is not necessary for you to have 2 insurances, because that would be a waste of resources and chaos in the environment. To be able to do this, you can clap if you want. To be able to do this, we've been engaging with the private sector in a very deep and meaningful way. And as a result, immediately after this executive order was released by Mr. Governor, we started to put together the components of the technical working group to develop the operational guidelines for the implementation of the executive order with a time frame of 3 weeks. And that the output of these operational guidelines will be made public as soon as it's available. Well, we were ambitious with 3 weeks. It's been more than 3 weeks, and I know I promised 3 weeks. But there are many people in this room who are part of that technical working group. And I know, because I'm following what's happening, that they've been working extremely hard, because it's actually a very difficult landscape to navigate. But I'm happy to tell you that they've met several times. They've exchanged very important data, documents, and I believe, and I am being reassured, that we're close to the realization of the operational guidelines for the implementation of the executive order. So those of you that are in this room that are part of the technical working group representing several aspects of the healthcare sector, you can clap for yourselves and you can clap for them. Number 3, we're going to give Lagosians a reasonable amount of time for our stakeholder engagement to create an orientation of both the public and the health sector. We're not draconian in our approach. But after a reasonable period of time of, say, 6 months to a year, we believe it will now be time for us to enforce the attributes of compelling residents to take out some form of health insurance. And we will do this through a multi-ministerial task force led by the Ministry of Health and coordinated by LASHMA to ensure that all citizens possess a valid state health insurance plan or an approved private health insurance plan from one of our accredited HMOs that contains the attributes of the social health insurance bouquet of services, but not both. In other words, again, to make it clear, if you already possess a social health insurance, or by virtue of this executive order, you now realize that you must have some form of insurance, and you opt to buy a private health insurance, that the relationship between the Lagos state government and the HMOs is such that those that are accredited by the state, that Ilera Eco, the content of a social health insurance is embedded in a private health insurance, and therefore you only need to buy one insurance and not two. Number 4, resources will be set aside to cater for any life-threatening emergency by any healthcare facility to stabilize the patient without requesting evidence of health insurance plan or cash as a prerequisite. This has been a perennial problem for us in Lagos, and we believe that this public-private partnership that we're about to enter into will make sure that if you are in a critical state and you are brought to any healthcare facility, that as a healthcare community, our job in the first 24 to 48 hours is to stabilize you, to save life, and ask about insurance or payment afterwards. And the Lagos state government is going to ensure this through the attributes of the guidelines that we're developing. Number 5, additional resources will be ring-fenced for vulnerable residents who cannot afford the state social health insurance plan. Such residents will be profiled for suitable enrollment under the expanded Lagos State Equity Fund. And number 6, A regulatory framework will be established to ensure a high standard of healthcare delivery by HEFAMA for those accredited providers. The technical working group will define a mechanism to monitor the efficiency and speed with which HMOs respond to both enrollees and providers. Compliance to actuarially determined plans will be particularly scrutinized. A public inquiry, complaints, and liaison office that can assist the public navigate the health insurance ecosystem effortlessly will be prioritized and established. And so these are the 6 main attributes of the executive order. So, to recap, if you live in Lagos, you will have social health insurance as a minimum. If you choose to buy private health insurance, that is your privilege. We will make sure that those people that are accredited to provide private health insurance in Lagos have incorporated the social health insurance into the private insurance, such that if that is your choice, you do not need to have 2 insurances. Your private health insurance will cover you and make sure that you are compliant with the law. If, however, you choose to just have Ilera Eco or the social health insurance, again, that is your choice and that is your opt. Through this public-private partnership, we expect to see some level of cross-subsidization, where those that are able to afford health insurance will provide some kind of cover for the vulnerable of this state, adding to the Lagos State government's initiative to provide social health insurance for its citizens. We're going to embark on a very large public health campaign to ensure that Lagosians understand the principles of health insurance, and within an acceptable period of time, we will start an enforcement. And the enforcement will domesticate the fact that we want all Lagosians to carry some degree of health insurance in their pockets. By doing this, we're going to make sure that both the private sector and Ilera Eco, their numbers increase exponentially, and that the viability of the health sector starts to increase, thereby injecting more finances into the health sector and restoring health back into the mainstream economy. We're going to look at the issue of capitation very seriously. We're going to look at the issue of fee for service. We're going to look at various models of capitation. And more importantly, we're going to work with the private sector to determine tiers of premiums that are scientifically derived through actuarial studies. Through a task force, we're going to try and make sure, with your cooperation, we don't want to be draconian in this activity, but we will trust that the health insurance agencies will not try to undermine each other and try and sell insurances that are not actuarially feasible. Because if that happens, then it undermines the premiums and the tariffs that can go to the healthcare providers. If we're able to restore health back into the mainstream economy through these strategies, then automatically we're going to slow down brain drain, because healthcare practitioners and providers and the health sector at large will suddenly find out that healthcare is now a viable economic endeavor. And the practitioners, in whatever form, will be less likely and less attracted to what appears to be greener grass across the fence. It will also start to attract our thousands and thousands of diasporians back home who are just waiting for the opportunity for us to get the regulation of the health sector right and the stratification of the economy of the health sector, thereby making it possible for them to come back home and practice their well-seasoned skills as specialists and subspecialists back here in Nigeria, thereby retarding medical tourism outbound. So what are the next steps? We are constantly aggregating comments from engagements, like here. At the end of today, I'm sure you have a number of questions for me. We've established the technical working group, as I said, is made up of key players in the health insurance space, the Ministry of Health, the NHIA, LASHMA, HCPAN, relevant medical professional bodies, providers and consultants. And they're busy working as we speak. They're working on a time frame, and I hope that they'll be able to deliver the first draft of the operational guidelines in the next week or two. The guidelines will be reviewed and made public, initiating the activation of the process, and the technical working group will continue to guide the process for a period till maturity. Let me just give you, as I end, some good news from His Excellency, the Governor of Lagos State. Can you see LASU and LASUCOM on your screen? If you see in the red starred box, you can see that there's a shortage of 30,000 healthcare professionals in Lagos. And what we've had up to date, according to WHO, we need about 1 doctor for every 1,000 citizens or residents. What we have in Lagos is 1 doctor for every 4,000. And I'm just using doctors as a surrogate marker. The same thing applies to nurses and pharmacists and dentists and so on and so forth. And so it's important that Lagos State starts to increase its production of healthcare professionals. And Mr. Governor has made it clear through several pronouncements that we're about to initiate the process of establishing the first standalone University of Medicine and Health Sciences in Lagos State. This will be called the University of Medicine and Health Sciences, and we hope that by transmutating LASUCOM, which currently resides in LASU, and bringing it out of LASU to become a standalone university, purely dedicated to the production of healthcare professionals, doctors, nurses, allied health professionals, pharmacists, dentists, and a myriad of other healthcare professionals that support the sector, that in about 3 years will be producing up to about 2,500 medical professionals instead of the 150 that we produce on an annual basis. How are we going to do this? Lagos is incredibly endowed with medical assets. So prior to this, we've been training our medical professionals at very limited locations like LASUTH or the School of Nursing. Whereas, if you look at the architecture of the health sector, as I described to you earlier, Lagos State alone in the public sector has 30 general hospitals, and the number is increasing. In fact, the number has gone up to 33, because every year we commission at least 3 or 4 new general hospitals. And we have about 300 primary health care, of which 60 are classified as comprehensive or flagships. And these flagships are 24 hours. They are large primary health care facilities with about 3 or 4 doctors and 15 nurses. And when we combine these 30 general hospitals with our 60 flagship facilities, we discovered, what can you see on your screen? 7 million. We discovered that in our general hospitals alone, in 1 year, we see 7 million patients. 7 million patients is enough to train 5,000 doctors. And so Lagos State is not short of patients through which we can make medical professionals. Because we all know that in health training, a small component of health training is didactic lectures. But a major component of medical training, whether it's as a doctor, a nurse, a physiotherapist, a pharmacist, a dentist, you are an apprentice for several years. And just like you make a mechanic and his apprentice, you practice under your master for 3 years until you graduate, and you get given your apprenticeship certificate. The same thing happens in medicine. We train our professionals hands-on. And therefore, if we have this number of patients presenting to our general hospitals for care, each and every one of those patients is a learning opportunity for students. And so when our students apply to study medicine in Lagos, I am told by the provost and the deanery of LASUCOM that we have at least 3,000 applicants that meet the requirement to study medicine. And of those 3,000, only 100 are taken. So we have an excess of 2,900 qualified students, young people who want to study medicine or want to study nursing or dentistry or pharmacy, and the number increases, and there is no opportunity for them to do so. And so they go into other disciplines, or they actually leave the country and go and study medicine if they're really determined, in Ukraine and in the Caribbean, in America or in England or wherever. And so as Lagos State government, we've decided that we're going to harness and sweat our assets and use our massive general hospitals to become a group of training facilities and train thousands of medical professionals a year in about 3 to 5 years. That process is going to take us some time, but the process has started, and we've been given approval by the State Executive Council for the master plan. We've been given approval for the draft law, and so the process has kicked off. And in the next few months, we should start the rudimentary activities that are going to lead to an increasing number of intake every year until we hit 2,500 intake for Lagos State. This is going to be based on a multi-campus strategy, based on the Ibile zoning of Lagos, where the general hospitals and their PHCs will be clustered. And there will be a main campus where thousands of students will be admitted every year. And when they finished their didactic component, they will be farmed out to the general hospital campuses, where they will continue to learn and graduate after 3 or 4 years as doctors, dentists, pharmacists, nurses, and a myriad of other allied healthcare professionals to support the problem that we're experiencing with brain drain, to put more professionals into the sector so that those that do want to leave the country for whatever reason, even though at the same time we're trying to perfect the healthcare sector in Lagos, but we cannot stop you from leaving And there are legitimate reasons why people leave and go to other countries. I, for example, have left Nigeria several times. And there are many doctors in this room and other healthcare professionals that have gone to gain experience abroad. There's nothing wrong with that. But what we must do is to make enough so that those that want to leave can leave without creating a void. And we must also make sure that those that have left will want to come back with a plethora of skill sets that they've acquired abroad and come back to Nigeria, to Lagos and other cities in Nigeria, and contribute to the healthcare delivery of this nation. And so, those are the strategies of the government. One, produce more doctors, more allied health professionals, more dentists, more pharmacists, more nurses. Number two, activate brain gain. In the process of activating brain gain, we must make Lagos and Nigeria conducive for diasporan doctors to come back, or for anybody that's gone abroad to learn a skill. And if you go abroad to learn a skill, and you then look back at Nigeria, and you don't see anywhere where you can practice that skill in Nigeria, then there's no reason for you to come back. And so as government, we're going to increase the diversity of specialties. We're going to increase the diversity of infrastructure that can deliver a diversity of subspecialties in Lagos. And we're going to try our best through the executive order to restore health care into the mainstream economy. And so, in line with Governor Babajide's Sanwo-Olu's government's 30-year strategy, we are on course to produce more medical professionals, to restore the healthcare sector into mainstream economy, to transform the infrastructure of health facilities in Lagos, to create an enabling environment for the private sector. And I'm very happy to announce that every month I am invited to commission or to inspect a very comprehensive healthcare facility that is opening in Lagos. Every month. Sometimes twice in a month. And that is an indication that something is happening in Lagos. Something very positive is happening in Lagos. And that this process of restoring healthcare into the mainstream economy has indeed commenced. And while Lagos has become that city that everybody wants to come to for culture, for cuisine, for entertainment, in the next few years, Lagos will become that city that people want to come to get quality healthcare services. And I'm not the person that funded an independent assessment of megacities in Africa. I saw the report online like everybody else. And that report said that Lagos State is now the 8th city in Africa for quality healthcare delivery. After Cape Town, Johannesburg, Pretoria, Nairobi, Tunisia, Cairo, and Algiers came Lagos. And according to Mr. Governor's plan, we're going to inch ourselves down that ladder. By next year, we will be the 7th. The year after, we'll be the 6th. Until we get to that number 1 position for West Africa and Sub-Saharan Africa. And if we can become the place that is known for producing quality healthcare professionals, for that place that has quality health infrastructure and a full spectrum of medical specialties and subspecialties, then we would have achieved the dream that Lagos indeed can put itself on the same pedestal as London, Paris, New York, Milan. We need to add Lagos to that list. Thank you very much.
I think we can do better. A standing ovation for the Honorable Commissioner. Thank you so much, Professor. Yeah, we are going to entertain, please you can have your seat. So we are going to entertain 2 questions from the audience, but there are a few takeaways and excerpts from the presentation of the commissioner. He was able to take us into the health ecology of Lagos State, the demographics, and of course the GDP of Lagos, which stand at 43 trillion naira today, and the economic vibrancy of the state, the potentials in Lagos State, and he was able, again, to take us to the executive order, which has some 6 attributes. The number 1 public awareness campaign to achieving universal health coverage by reorientation and mind shift of healthcare providers from out of pocket payments. The effort of the Ministry of Health to intensify engagement with HMOs to synergize and synchronize public and private health insurance for comfort and convenience through PPP, and the negotiations to enjoy a reasonable amount of time for orientation before the enforcement of the executive order. So, and some next steps, what the Lagos State is doing, and of course, the Honorable Commissioner gave us some fantastic positive news. So on this note, we are going to entertain just two questions for the Honorable Commissioner. Questions? And okay, please. Yeah, number one. Any other one?
So we take you standing one, and then we take a lady so that we can balance. Take 4 questions.
Okay, graciously, the commissioner said we can take 4 questions. Thank you.
So let's keep the number so it doesn't become round. So we have 1, 2, we have 3. So 3 so far. Thank you. And 4. So the 4th woman. You want?
All protocol duly observed. Honorable Commissioner, please, I want to know whether this social health insurance covers mental health.
All protocol duly observed. The Honorable Commissioner, sir, the projection of having so many doctors trained in Lagos gives me concern because I don't know whether we are also going to get all of them employed. I have 3 children who are qualified as medical doctors. They could not get placement for internship in Lagos. I worked for the Lagos State Health Service Commission for 32 years, and yet I am not strong enough to have a placement for my children for internship. Even I have so many, I don't know who's going to employ them. 1. 2, who will accredit those facilities I want to use for this training? Is it the Universities Commission or the MDCN? So what accreditation are those facilities going to have? And the people that are trained there, what degrees are we going to give them? Bedside doctors, university doctors. Thank you, sir.
Third person.
All protocol duly observed. So my only question is just that there are some of us that put in for this Lashma enrollment as an hospital. But before we could finish the process, the portal was closed. So we could not be able to continue with the process of being enlisted as part of the hospitals providers. So that's my question, please.
Honorable Commissioner, sir, my own question is similar to what our brother has just asked. For those of the facilities that are interested, and you have put in your application since last year, July, and you are yet to be inspected, not to even be enrolled, what can we do to that, sir? Thank you.
Sorry, facilities for where?
I mean, the facilities that want to enroll under Ilera Eco, providing care for the Lagosians, and you have a lot of people around you that has already enrolled as Ilera Eco coming to your facility, and they cannot access it because there is delay in inspecting and in enrolling in such hospital.
Okay, thank you. Right. So the first question was around whether the state health insurance, the social health insurance covers mental health. So we have a preventative and grassroots mental health strategy for Lagos that is driven through our primary healthcare facilities. And so the basic minimum package for social health insurance does cover you for the type of mental health remedial treatments that are available at the primary healthcare level. If your mental health situation is so serious that you need to be referred to a secondary or a tertiary facility, well, the government knows that those are the kinds of medical conditions that fall under the responsibility of the government. Just like if you catch COVID or you catch Ebola or you catch Mpox, nobody is going to ask you for money. There are certain conditions that are completely the responsibility of government. So if you have severe mental health issues, we have our secondary healthcare facilities and our tertiary healthcare facilities, and we're just about to build, or we're building, the largest mental health institute in Nigeria, if not in West Africa, at Ketu Ejiri. In its first phase, it's 500 beds. In its second phase, it's going to increase to 1,500. This is because we understand that mental health issues are a significant burden in the healthcare space, and we are anticipating that as Lagos gets bigger and bigger and more congested, that it is something that we really need to pay attention to. And so we're trying to establish a mental health institute that will address primarily early detection, prevention, early detection, and evidence-based management of mental health. But to be specific about your question, at the primary healthcare level, the attributes and the treatments for mental health are covered by the basic, the social health plan. The question around the employment of graduates of medicine for house jobs and other medical employment. You see, this is the whole reason that we're talking about healthcare is not in the mainstream economy. If the WHO says that you should have one doctor for between 600 and 1,000 residents, and you have one doctor for 4,000 residents, you are overworking your medical manpower 4 times. Now, if we cannot create the employment for 4,000 doctors, for one doctor for 1,000 patients, then that means that the system is not economically structured to absorb these medical professionals. And that is what we're trying to do. Additionally, I didn't give you that statistic, but based on the WHO, Lagos State has a significant shortfall of medical beds, almost equivalent to the shortfall of medical practitioners. And we're not just talking about the average bed, because when you're talking about medical beds, you need to classify your beds into general beds, into specialist beds, and into intensive beds or intensive care beds. Now, if we have a significant shortage of beds, when we do increase the number of beds in the state, most likely that increase is going to take place in the private sector. To be able to match the WHO criteria and balance the number of medical professionals to the population, we're going to need to absorb this number of medical professionals. And so while we may not be there at this point in time, and when you look at the entry into house jobs, it's actually not a correct reflection, because there is a bottleneck around house jobs. Whereas we should have house job training accreditation in multiple private sector hospitals, not only in our general hospitals or in our teaching hospitals. And all our general hospitals should be able to take in house officers. And that is where we're going with this whole initiative, to upgrade the infrastructure of our general hospitals, to accredit all of them for house jobs, not just house jobs, but other disciplines, particularly family medicine, surgery, medicine, obstetrics, pediatrics, that every general hospital and a sizable number of private multi-specialist hospitals will be accredited for house officer training and for discipline specialty training in Lagos State. So we're hoping to rejig the system so that scenario that you just described, which is real, but it's a problematic scenario because it does not reflect the need of Lagosians. Regarding LASHMA enrollment, well, LASHMA is rejigging itself all the time. And I believe that with this enforcement of the executive order, there'll be a lot more finances going into LASHMA, and that they'll be able to improve on their efficiency, such that when you try and apply for your insurance, it goes through speedily, and that you receive acknowledgement of your enrollment in an acceptable time frame, and that after 12 months, as your enrollment is about to expire, that you get a notification that, dear Mr. Lagbaja, you enrolled for insurance 11 months ago. In about 1 month, your social health insurance is going to expire, and we are encouraging you. We'll collect data from you at the same time. We're encouraging you to come and renew. It is based on the quality of care that we're able to deliver that will encourage people to renew their insurances. If they've had a bad experience, they're not likely to renew. They're likely to revert to cash or pay out of pocket. And so it is the responsibility of government, through establishing proper quality services, through ensuring that we are protecting the space of insurance and making sure that we only get positive feedback. I have used insurance cards all over the world. I tell you, when you are sick and you are able to bring out an insurance card and present it at your healthcare provider, it is such a relief that you don't have to pay not only for the healthcare or for the surgery or whatever it is you need, or the medication. You don't need to write a check or bring money out or do a transfer. That this your simple health insurance card, through the principles of health insurance and pooled funding, is taking care of your medical needs. That is where we're trying to get to in Lagos, and we hope that complaint that you brought up just now is going to become less and less of an experience for citizens of Lagos. The same thing applies to the enrollment of facilities. There is a backlog, I'm aware. But then again, it's because of this narrative of not enough finances being injected into the system, because there's a shortage of enrollment. Once the numbers of enrollees starts to pick up by virtue of this executive order, then year by year, the speed with which we're able to satisfy your request for enrollment, for your request for accreditation, will start to improve. And with this partnership that we're developing with the private sector, we're going to see health insurance as one holistic package for Lagosians, with Lagosians having a choice of either going to an accredited health insurance agency to get an accredited premium that is regulated, and that when you need it, you actually get the services that are described in that tier of healthcare premium, and that the healthcare providers are getting the correct remuneration for their services. That is what is going to encourage the industry of healthcare delivery in a manner that is sustainable, in a manner that is satisfactory to everybody, and in a manner that retards brain drain, accelerates brain gain, and allows us to deliver universal healthcare coverage to our citizens. So thank you very much for those questions. I hope I've answered them, and thank you very much for your time.
Thank you very much, Honorable Commissioner, for that presentation, which has, helped us to understand more. It's a very, very, very insightful and deep teaching. So at this point, we will like to give the award to the Honorable Commissioner. So I call on the Chairman, Lagos State, to come up, and then we call on our HCPAN Mama, the past president, Dr. Ms. Olaniba, to come and help to present this award. Again, joined by our leaders, the past president, the current president, and members of the high table for a group photograph. Yes, here is okay.
On behalf of the Healthcare Provider Association of Nigeria, Lagos State Branch, and the National Supporting, we want to present this plaque to the Honorable Commissioner for Health for Lagos State, Professor Akinola Abayomi, Commissioner for Health for Lagos State, in recognition of his contribution as special guest of honor at the 2024 Scientific Conference and Annual General Meeting held in Lagos today. Permit me to go memory lane. Well, they introduced me as Mama HCPAN. And I feel so emotional today, standing with a health commissioner that seemed to understand the nitty-gritty of health insurance, not only in Nigeria, but in the diaspora. Professor Akinola Abayomi, I know must have been someone that's enjoyed or participated in the implementation of national health scheme in the UK. And he knows how the British government values its NHS system. I believe if he can replicate something like that in Nigeria, which I can see from all his presentation, it will go a long way in having fantastic and first-class health insurance system, not only in Lagos State, but in Nigeria at large. He has identified the most critical needs which are required in establishing health insurance. The professionals, the healthcare professionals that are going to run the system, the infrastructure that are required, both technical and otherwise. He has also enumerated the steps that he's going to introduce in Lagos State to ensure that that Japa syndrome will become Japada. Not only in Lagos State, but in Nigeria. Professor, sir, I wanted to go down memory lane, but I will stop here. Because I could remember when, the president, Olusegun Obasanjo, made a presidential executive directive in 2005 and said all Nigerians should embrace national health insurance scheme. Many of us who are healthcare professionals, we quickly embraced it, and we thought that was going to be the savior of the abysmal healthcare indices that we had then in Nigeria. Lo and behold, almost 20 years, we are still enumerating the abysmal healthcare indices. Sir, I know during your tenure, those indices that you have rolled out, they are going to reduce drastically to the extent that Nigeria will occupy that space, in healthcare sphere in the world, that we will not be relegated to the back anymore. We know that in Lagos State, you have healthcare professionals that are passionate to carry out this executive order. And I just want to appeal to you, sir. You have said appropriate remuneration should be paid to whom it is due. I want to appeal that LASHMA should please consider this. And under the operational guidelines that is going to come, we want to say, please consider those who are going to run the scheme, so that those younger doctors, those younger professionals, once they see that there is political will, which I saw in Ghana when I went to study Ghanaian health insurance, which I saw in Rwanda when I went to study the healthcare insurance in Rwanda. Political will carries a lot of weight. I'm happy that we are having political will through you, sir, Professor Akinola Abayomi. Thank you very much. Please sustain that political will. It is extremely important. Thank you. God bless you, sir. Thank you.
Congratulations. Okay.
Thank you.
To the distinguished leadership of this great organization, I'm glad that we're resonating around the principles that are required for us to achieve the required destination of universal health care. The principles, as we have outlined, I promise you that this government is totally committed, and we are not going to rest until you see the numbers for insurance ramping up, until we see appropriate capitation being given to the facilities, until we see appropriate tariffs for services delivered, and until we see a social safety net for the vulnerable of Lagos. It's a journey that has begun, but it is accelerating now. And that is why I've taken my time to come here and spend this amount of time trying to encourage you that don't give up on us. We are very, very determined and very focused on the target. We must retard brain drain. We must accelerate brain gain. We must restore the health fraternity to a state of pride, to a state where it plays its significant role in the GDP and the economy of our state and our nation. And that, I promise you, is the number one priority of this government in the health sector. And thank you very much for the award.
Thank you, sir.
Thank you, sir.
Thank you very much. So we'll quickly take a photograph so that can we say in front? Is we say in front of all? Oh, is he okay? Yes.
Thank you. Thank you.
Thank you. Yes. Thank you very much. Some music on the background as the Honorable Commissioner walks down the stage. Okay. So we can present the other award. Shall we? The keynote speaker. Would you move it? Can you help me? This guy is not here. For us to move it back to center. All right. Okay. So, as the commissioner walks down, still in the mood of presentation of plaques, we would like to also quickly present to the keynote speaker, Dr. Jephthah Layton. Dr. Jephthah, please, so you can have your presentation, your plaque. So we would like Pharmacist Funshaw to help us do that. Pharmacist Funshaw, please. Yes, sir. Yes, sir. Yes, please come and help. Yes, to help make a presentation to our keynote speaker. Let's come this.
Praise the Lord. Praise the Lord. We thank God for today, and we appreciate your presentation. I pray that the Almighty God will continue to lift you up, and you continue to be relevant everywhere you go. So this plaque is presented to you for the wonderful job that you have done as the keynote address speaker. And it's presented to you by the Health Care Professional Association of Nigeria, Lagos State. Thank you very much. The Lord be with you. Thank you, sir.
Thank you very much. Thank you, sir. Thank you. So make sure you don't go. The Senate president said, Nigerians, anywhere you see food, do what? Eat. Don't go before eating. Okay.
The Healthcare Providers Association of Nigeria, HCPAN, Lagos State Chapter, presents 2024 Annual General Meeting and Scientific Conference. Theme, Leveraging Digital Technology to Improve Resident Enrollment.
Okay, so we want you to be upstanding. Please, let's rise. Let's rise.
Health insurance
we have been sitting for a while.
Experiences and adopting best practices.
So we'll stretch our
Special
leg.
presentation, Understanding
Please,
the
let's
Executive
rise.
Order on Health Insurance by the Governor of Lagos State. Chairman of the occasion, Asiwaju Dr. Michael Olawale Cole. Immediate past president, Lagos Chamber of Commerce and Industry. Special guest of honor, Professor Akin Abayomi, OON, Honorable Commissioner for Health, Lagos State. Keynote address speaker, Dr. Jefta Aleiton, Head of Design, Weather Health Technology Limited. Guest speakers, Dr. Emmanuel Azamba, Permanent Secretary, Lashma. Pharmacist Dr. Olubumi Jetawo Winter, Executive Secretary, Kwara State Health Insurance Agency. Host, Pharmacist Mrs. Biola Paul Ozie, Chairman, HCPAN Lagos. Date, Tuesday, 15th October 2024. Time, 8:30 a.m. prompt. Venue, Lagos Chamber of Commerce and Industry Conference Center, LCCI, CBD, Alausa. This hybrid event will be streamed live on PharmaStream TV YouTube channel platform. Subscribe today to get instant live notifications. Announcer, Pharmacist Isaac Olufumini, CPC Chairman.
So let's use the 2 minutes to also visit the exhibition stand. Stretch your leg, visit the exhibition, get to greet with someone before we come for the final phase, please. Woman from
Ladies and gentlemen, giving a goodwill message after the commissioner has spoken is a Herculean task. Because as the commissioner exits, he takes with him half the hall. But I must say that I consider myself to be a member in good standing of HCPAN. We have collaborated this many years for more than 15 years with HCPAN. I was present at its foundation. And I would like to assure members that good times are ahead. I would also like to assure you that you have the support and collaboration of the Health and Managed Care Association of Nigeria. So I wish you very good deliberations, and I wish you a very, very bright future. So help us God. Thank you.
Thank you very much, Dr. Oshunyi. The next person to give her goodwill message is the president of HCPAN, Dr. Pamela Ajayi. Let's put our hands together as we welcome her to the stage.
Good afternoon, distinguished colleagues, ladies and gentlemen, esteemed members of the HCPAN community. Please permit me to stand on existing protocol as I follow my brother, Dr. Leke Oshunyi, to give a goodwill message after the commissioner has gone. I think it's actually more appropriate to call this a summary, because we just want to say that as the president of the Healthcare Federation of Nigeria, we stand in support of the work, the fantastic work that is being done by the HCPAN. We want to thank the Lagos State Chapter Chairman, Pharmacist Paul Ozie, the National Chairman, the past presidents that have all been here present, and to say that this has been an extremely interesting and enlightening session. I want to commend them for this very exciting topic. The theme was relevant, the theme was essential and is essential and extremely futuristic. The use of digitalization, leveraging technology, and eventually the use of artificial intelligence will stand us in good stead as we in our country, Nigeria, seek to leapfrog over the hurdles that we've had in the past and move ourselves into the future, a brighter tomorrow. One of the speakers spoke about the need for government intervention. And we've had the Lagos State Commissioner talk a lot about what Lagos State is doing in terms of providing the ship. We've had the Lashma people talk about how they are digitalizing and moving forward. But I also want to share with you that we had our healthcare policy dialogue in Abuja last week, where we had the Minister of State for Health he actually rolled out his digital program. So this is a national program, and it's something that I want to say we are all a part of. And I would like to say thank you on behalf of myself and other members of the technical working group on the health insurance in Lagos State for bringing this to the fore. And I wish us all successful deliberations and a very successful AGM. Thank you very much.
Thank you very much, Dr. Pamela Ajayi. Next, we have a representative from NHIA.
The NHIA people. Yes, Hadia, yes. Close.
We have a lot of questions for them.
Okay. So you can say it.
Next, we are going to be taking questions after the NHIA representative gives her vote of thanks. We will be taking questions for Lashma, Lagos State. So please, if you have your questions, just get them in line.
Apologies. Lagos SP354DA, black. You are blocking someone, please. Lagos 6x470. SP354DA.
Good afternoon, ladies and gentlemen. I don't know, what name did you call me? Because I've heard several different names. I've been titled Umar. Please, my name is Aisha Ubakaruna because I don't want to get to my husband was with me. Yeah, I want to thank everyone for being here. As the national body, we are happy with the Healthcare Provider Association of Nigeria for their annual general meeting. I actually came prepared for a speech, but I think with all the presenters, everything that I'm supposed to say here has been said. So I say thank you and God bless you all.
All right, so some people say they have questions for Lashma. So this will be a good time we had to tell Lashma presenter to be available, to be able to take the questions, those challenges we have, so that it will go direct to the permanent secretary. So it will be nice to use this interlude to have that interaction, ask your question or to Lashma or make the comment. So we'd like the Lashma rep to be up while we can take that quickly. So do we have anyone that wants to ask questions or make comments? There are some things directed to the commissioner, which was supposed to be directed to yes, please. Let's use this time to take it. There is a hand up. Where your team? The usher. No usher.
One, two.
Good afternoon, everyone. Please, my own question is this. As a provider or intending provider that has put in applications since July last year, and I was promised that they are coming to inspect. Each time I call, they will tell me to send reminder. It's more than a year now. I have not seen them to come and inspect. And patients or the enrollees around my vicinity kept on coming. But I tell them that there's nothing I can do because I have not been co-opted into the Ilera Eco to be able to give the service to them. So, Ma, what can you do to fast track the, inspection and co-opting us into Ilera Eco as a provider? I'm running a maternity home. Thank you very much, Ma.
My own question is simply like this. Last year, my place had been approved to be registered. So I put in all necessary documents online. Hello? I put in all my documents online completely. But it came to the point that I'm supposed to print out those things so that I can bind them and submit it to the office. But at that point in time now, the thing was, the portal was closed. So I could not be able to print out those things any longer. And then I was not enrolled eventually. So that's what happened.
What kind of provider?
My facility?
Community pharmacy.
Sorry?
What's your facility?
Ever Life Hospital. Ever.
It's a hospital.
Yes, it's an hospital. Ever Life Hospital.
Okay, thank you very much. Any more questions?
Any more questions for Lashma? Do you have any concern that you want Lashma to address, please? Okay, we have one more. Please, yes.
Good evening, everybody. Lashma, you have asked us to give medication to patients after 8 p.m., Monday to Saturday, and also on Sundays. Are we going to be paid what you would have paid the pharmacist if we give medications on these days? Or is this still part of your capitation?
Thank you. Any more questions? Because she wants to take them all. Okay, thank you very much. You can go on now.
Dr. Fadikwe. Dr. Fadikwe. Okay, thank you very much for the questions. First and foremost, I want to talk about the Lashma empanelment process. It starts with writing a letter to the agency, and then you go through some things, and then we would actually say we are coming to visit you for a quality visit. I have taken note of the maternity home that was not visited, because the process is usually... Anna, you can sit down, it's okay. Oh, you can... Can we hear me now?
Turn off that mic. Hello.
That's put in. Can we hear me now? Yes, she hasn't been visited for a minute. Okay. So the empanelment process is quite simple, and we actually have a desk out there where we can be taking through the steps for those of us who want to join. Usually we would communicate with you and come and visit. I'm not sure what happened in that case, but it's something that will take your details and get back to you. But the visit usually happens. Okay. So after the requirements, we would come and visit. And we have promised that we've come to visit for a year now, haven't visited. So we'll look into that individual case. For the Evercare, I'm not sure which portal you are referring to that's closed, because we do not use any portal that closes. So we would also take it on a one-on-one basis and see what went wrong. We do not use any portal. You write us a letter. We ask for some requirements. You go through some things like CAC, procurement, and things like that. You've done all of that. And then the next step is we come and do a quality assessment. So there's no closed portal. So we also have a table there that we can take it on a one-on-one basis. We also got a question about healthcare provider giving medication after hours of the community pharmacy. Ma, you recall that this is a drug access expansion program. The payments you are getting includes medication, but we are giving enrollees extra access to get their drugs outside. So if that drug is covered by capitation, it is part of capitation. However, if it is a fee-for-service drug, please claim appropriately and you'll be paid for it. I hope that was clear, Ma. Thank you very much. In the absence of any other questions, I want to say please visit our Ilera Eco stand out there if you are not yet a provider on Ilera Eco. My colleagues are there to put you through the process of empaneling your healthcare facility on Ilera Eco. If you also do not have a social health insurance, we also have the enrollment team out there that are ready to enroll you on Ilera Eco. Thank you very much, sirs and ma'ams.
Thank you very much. Chairman, HCPAN Lagos. Okay, Secretary, please. Nurse Teresa. So we are officially rounding up this first phase of the program with a vote of thanks from Nurse Teresa Okwash, the Secretary of HCPAN Lagos, after which we go straight to the short annual general meeting. Remember, it is an election year, so the AGM, the meeting proper, is short so that we can round up. And it's important that you participate in this event. It's very important that you participate. So, I was delaying because she's... we've given Jeff now. So who are you? Okay, so you call. Let me call them. Okay, so you will now say just before she does the vote of thanks, we need to give this up. Because once we do vote of thanks. Okay, so before she does the vote of thanks, we quickly give award to the presenter from Lashma, and also an order to the representative of Kwara State Health Insurance. So as I was saying, the Senate President said, Nigerians, anywhere you see food, eat. Make sure you eat your food because you don't know where the next is coming from. So ensure you eat. So, what do you want?
This is an award for her, represented by Mrs.
Okay, what? So we call on the state chairman, HCPAN. Please come. So you talk. I'll complete it.
Okay. We are presenting an award to the Permanent Secretary, Dr. Emanuela Zamba. She's the Permanent Secretary, Lashma. She is represented here today by Mrs. Adetoro. And the award will be presented by Mrs. Adebisi Ade Onojobi Daniels. She's a radiographer. Please come off stage, ma. Thank you.
So she's the one presenting the award.
afternoon. Good afternoon, everyone. I know our mouths are busy, so we won't be able to answer. This is an award of the Healthcare Providers Association of Nigeria, Lagos chapter. Appreciation Award. This award is presented to Dr. Emanuela Zamba, Permanent Secretary, LASHMA, in recognition of your contribution as guest speaker at the 2024 Scientific Conference and Annual General Meeting held at LCCI Alausa this day, 15th October 2024.
President. Okay, so the next award we go to Farm Olubumi Jetawo, who also joined online. She's in charge of Kwara State Health Insurance Scheme. And that award will be presented by our HCPAN National President, Dr. Sinaipo. Please help us present the award to the Farm Olubumi Jetawo Winter, Executive Secretary, Kwara State Health Insurance Agency.
So Pharmacist Tolu Ajayi should please come forward to collect it on our behalf. The Chairman, HCPAN Lagos State, Pharmacist Tolu Ajayi, to please come forward to collect Dr. Jetta gifts. Thank you.
HCPAN Appreciation Award presented to pharmacist Dr. Olubumi Jetawo Winter, the Executive Secretary, Kwara State Health Insurance Agency, in recognition of your contribution as guest speaker at this 2024 Scientific Conference and AGM of HCPAN Lagos held today at LCCI. Congratulations.
Let's clap for our chairman now. Congratulations. Okay, so now Teresa, please. Our Secretary, HCPAN Lagos.
Good day, everyone. Let me start by giving glory to God Almighty for making this program a huge success. On behalf of the Executive Council and the entire HCPAN Lagos chapter, I would like to express my heartfelt gratitude to all our special guests. Guests of honor, Professor Akeola Abayomi, the Honorable Commissioner for Health, Lagos State, who took time from his busy schedule to grace this occasion today. We are grateful to all distinguished speakers, Dr. Jetta Aletan, Dr. Emanuela Zamba, PS Lashman, and Dr. Olubumi Jetawo Winter, ES Kwara State Health Insurance Agency, for making the theme and the sub-theme, respectively, interesting, impactful, and meaningful. Special appreciation goes to the chairman of this occasion, Asiwaju Dr. Olawale Ko, the immediate past president of LCCI, for taking time out of his schedule to be with us at this event. Thank you very much, sir. I would like to thank all government functionaries present here today, especially the FMIES, Dr. Abiola Idowu, NHIA Lagos State Zonal Director, Mrs. Ogundimu, and our numerous special guests and guests. This vote of thanks will not be complete without appreciating our sponsors and partners at this program, the exhibitors, advertisers, the gentlemen of the press. We will not have recorded this success without your support. We appreciate the contributions of the members of the planning committee for the job well done. So the moderators, the directors of today's scientific session, Drs. Emmanuel Onyenuche, Wale Oladapo, and Chinwe Ubo, I say a big thank you for the beautiful and colorful coverage you gave to this program. Our sincere thanks to the affiliate heads and their representative HCPAN Vice Chairman. The dedication of the Executive Committee under the chairmanship of a pragmatic leader, pharmacist Mrs. Biola Paul Ozier, is well acknowledged. Finally, I would like to appreciate everyone present here today for making time to be with us. Your presence has made the event a resounding success. Thank you, and do have a safe trip back to your different destinations. God bless you.
So thank you very much for that wonderful vote of thanks, which is the end of the first phase. So please let's come forward for the AGM proper, which the chairman has promised won't take time. The AGM is the last part of this event. So it doesn't usually take time in an election year. And the chairman has promised that. You can take this.
Good afternoon, ladies and gentlemen. No, I don't. I'm going to sit here. Please, all officers of HCPAN, can you please come over here? We're about to start the AGM. Item 1 on the agenda is called to order. Please, we are ready to start the AGM. Shall we come around? Sorry, we have decided not to say closing prayer for the first session, so that some people won't think that's the end. In fact, this is the main. We have had a number of lectures today, and some of our speakers have given us directions. They have given us thoughts we should deliberate on. And so I want us to please wait. I want to promise us that latest by 4, we will be out. Latest at the most, we'll be out of here. So opening prayer. Can pharmacist Adego Keshanusi come and give us the opening prayer? For the AGM, please. Yeah.